Tell you what, let's start. If you'll stand, and we'll have an invocation and our Pledge of Allegiance. Dear Heavenly Father, we thank you for a beautiful day and for the cooler weather this time of the year. And we just thank you for a good gathering here this morning to discuss the budget. It's an important subject, Father, and we turn it over to you and ask that you grant us wisdom, that we would have a productive meeting, that you would guide us and lead us to make the decisions that are best for this county. We're thankful for each person here. We ask your blessing upon this group and upon the families that they represent. And just go with us throughout this day. Protect us, take care of us, and forgive us of our sins. In Jesus' name, amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you. Have a seat. Okay. I guess we should go ahead and have the drawing for the Caribbean vacation, huh? All right, well, it's good to have a big crowd here. This is interesting. This is probably a first. But nonetheless, we've got a variety of topics to discuss today, and I don't have any formal agenda, but I do have CAPS Insurance here with us today, and so to respect their time, I'm going to begin the discussion with some health insurance issues, and you may have some things that you'd like to present to us, maybe a continuation of our conversation a couple of weeks ago, and if you'd like to do that, I'll turn it over to you. And if you would, maybe take a seat up here at the table. I've got 2 live mics down there, and we do have video and audio rolling today. So Steve Capps from Capps Insurance, Tony Melton from Capps Insurance. And for those of you that have not dealt with Tony or her assistant or with Steve, and if you ever need to regarding a health insurance question or matter, they're a good source of information, and I'll be glad to get you their email, their phone number, but they are excellent about getting quick answers and getting back to you. So if you feel frustrated about a health insurance matter and you don't know where to turn, you contact me or you contact CAPS Insurance, and remember Tony's name, and again, they'll get quick answers. But I appreciate those that have brought to me over this past year some health insurance concerns, that most of which I think we got answers for. And it was just a matter of discussing or being aware of the situation, bringing it to CAPS's attention. The commissioners took action on those, and again, I think we eliminated most of the concerns that were there. With that said, Steve, I'll turn it over to you, and thank you for being here.
Thank you. And just like I said, to continue our conversation from our last meeting.
Pull that mic up there to you, would you? There you go.
One of the things that we had information we wanted, we didn't have the last meeting, was what impact it would have on the county benefit plan to make a few minor benefit changes. And we did get those, and we had discussed moving your deductible from your current $750 deductible to maybe just looking to see what it would save the county to move to a $1,000 deductible. And they call it plan day, but -2%. In other words, it should reduce your overall claims by about 2%.
2%?
2%. I'll give you kind of some numbers on that in just a minute, dollar numbers. And then also we had just looked at moving from currently at 90% coverage. In other words, after your deductible, the plan pays 90%, changing that from after your deductible to 80%, right? And that's a 1%, approximately 1% savings. Okay, so if you make both those plan changes under your claims through July, actual paid amount is about $215,000 somewhere along there. Actually, the allowed amount, call it $300,000. So you're talking about, if you did both plan changes, it would save you approximately $9,000 a year. Okay, by making those 2 changes. Okay, about $9,000 a year. Okay, you're having a very good year. We haven't had any large things so far, and so when you have a lower claims amount, then you take that percentage by a lower number, it's going to be a lower dollar amount. Okay, so you know, if that number was 600,000, well, obviously it'd be a different number as far as savings goes. So fortunately, you're running very, very well as far as your claims history goes. So you know, not a huge savings in dollars to make those changes this year. Okay.
You talked about 90 to 80, but the maximum out of pocket for the employee would
Stay the same. That's correct. Not
At
changing the
what?
pocket amount. You just would get there a little faster. That's right.
If an employee had a $10,000 procedure done, what is our out of pocket, 4 or 3?
Anyway, what we're proposing is
That's going to be out of pocket $3,000 period.
Right.
No matter whether we were 90 or 80.
That's correct. That's correct. Now, if you made the deductible change and the co-insurance, then it's extra $250 out of the employee's pocket per year. That's correct.
Well, like you said, this is a fairly low claims year. If we looked at a more average or typical year, that, would you say 300,000?
Yeah, I mean, your allowed amounts is 288,000 through July.
Through July.
3%
So
of that,
that's not a full year.
That's correct. That's not a full year. So that's true.
So if it was a full year, it'd be 600,000 if we are tracking the same way.
18 you're in college, you know, if you make both plan changes.
Okay. And once again, a relatively low claims year, we think. But again, if we continue that to a full 12-month period, say $600,000 in claims, that 3% would be more like an $18,000 savings to the county. Okay. And that would encompass an increase of the deductibles from $750 up to $1,000 and a 90% co-insurance down to 80%. Last year, we had been at, was it 600 or 650? I don't remember.
On your deductible?
Previously.
500, I believe. Oh, it's 6, went from 6 to 750.
Okay. Okay, so last year we went from 6 to 750 last year. We kept the co-insurance stayed the same at 90%, as I recall. Okay.
I think the point to make there, Bert, is I know the 90 to 80, the plans gives you some credit, but I don't really think 90% of the cases should affect the employees. But like I said, most procedures are cost over $3,000 anyway, so they're going to be out the maximum. The most they can be out of pocket is the $3,000, about whether it's 90, 80, 70, 60, 50. The company's getting credit for it.
But if they surpass their deductible, it's going to cost them another $250 a year.
That part.
At the most.
That part is true. That is a cost. I don't know the second part.
Yeah, large claim is not going to have any effect on it.
Where it's probably going to impact
Out of
somebody
pocket.
more is it like somebody that's fitting in the middle, that's not going to reach the maximum out of pocket.
Okay. All right. There's one cost savings opportunity, actually two different cost savings opportunities. All right, go ahead.
And then I was going to let Tony visit you. We had talked about changing up your life insurance program a little bit. She has that information.
Thank you. Thank you.
When we last visited, we discussed that your life insurance is currently with Sun Life. At that point, about middle of, I don't know when we did it, Christy, but we did change it to where everybody's life insurance benefit is 1.5 times salary, up to a maximum of $50,000. We asked Sun Life to go back and to look at just doing a flat $50,000, which they had declined to do, and I think we talked about that at our last meeting. So I had an alternate plan quoted through Guardian. Guardian is one of our preferred carriers. But after our last meeting, I went back and I asked Guardian to also just quote a flat 50,000, but to also consider how the retirees are handled in that life insurance plan. If you'll look on page 2 of the proposal that I just sent you, or just handed you, you'll see you've got both of the options there. Plan 1 would be keeping the current retirees covered, and of which there are 28. And the 120 that you see under active, that plan is giving everyone that is an active employee a flat $50,000 worth of coverage, and retirees would stay at the flat $10,000 that they were currently covered at. That rate actually went down 1 cent from being the prior plan, the 1.5 times up to 50,000. So to raise everybody to a level 50,000 flat, your rate went down 1 cent on the basic life. It went down actually a little bit on the dependent life. It went down 1 cent that as well.
Where are you seeing that 1 penny? I'm missing that somewhere.
You're right here under your plan. You see right here, you've got plan 1.
Yes,
And then you see plan 2.
Yes.
The basic life per thousand
Yes.
is 30 cents.
right?
I'm just telling you that. That's, you're not, the went down 1 cent. It was 31 when they.
Oh, okay, I thought you were comparing Plan 1 to Plan 2.
I'm telling you that out of my head. Yeah, that's not there. Now,
Is that under the current carrier, or no?
No.
This is all proposal from Guardian?
Correct.
Okay.
Your current rate is 23 cents with your current carrier for 1.5 times up to 50,000. For Guardian to quote everybody, the whole shooting match with the retirees and the active people, their quote was 30 cents for basic and .025 for accidental death and dismemberment. That is if you keep the plan exactly the way it is, covering the current retirees, of which there are 28 of them. Plan 2 is if you drop the retirees and you only have the active people, but again, everyone having a flat 50,000, that makes your rate go to 23 cents for the basic, which would actually drop it down to 18,000 for the year, 18,168. I think Christy's concern is she's not really sure if the retirees know they have life insurance coverage, and she doesn't know how to find them.
Well, the second concern we had was, by going to the flat 50,000, we don't have to recalculate every time
Every time there's a payroll adjustment.
Which is or rate change or anything else. It saves us a lot of time.
So everybody that has a 1.5 times salary less than 50,000 would get bumped up to a $50,000 life insurance threshold, but those that are have a 1.5 times salary that puts them at above 50,000 would go down. But that's already in place. We made that move previously. So the main difference here between Plan 1 and Plan 2 is eliminating the life insurance on retirees, which again, the maximum amount for them is $10,000.
Now, does that 10,000 for the retirees go on forever? Is there a cutoff or until?
Forever, until they die.
There's a reduction.
The reduction amount?
No, the way I quoted it, well, it does reduce 50% at age 70. You're right. You're right. Exactly. Which we don't know what they're, well, we don't.
I have
Right now, the reductions on age, under the current policy that we're in right now, let's go over that one more time just for the benefit of those that are in the room so that everybody understands. Once you hit what age?
Well, actually, your current plan reduces at 60.
At 60.
That's part of the problem that Christy's having, because anybody that's over age 60, she's having to get evidence of insurability papers on for everything. And it doesn't, even if they fill out the evidence of insurability, they're still reducing the basic benefit that they receive as employee of the county.
Okay.
It's starting to reduce at age 60. That is and that's because your contract has been in place for so long. Reduction factors now generally start at 65, but we made these start at age 70, all of them.
Under the existing plan, at 60, it goes down by how much?
It starts reducing 35%.
Okay, once they hit 65, what happens?
Another 25%, and it's just going to keep on reducing every 5 years.
Okay.
I think it goes away, except
I think so.
somewhere there goes away.
Right.
Okay.
So this plan, they need to start reducing to age 70.
That's Plan 2.
Well, either of them. If you look down at the very bottom, reduction factors, you see that all, for everybody's benefit starts reducing at age 70.
Oh, yeah, okay.
Whether they're active or they're not.
The other thing I wanted to point out to you is currently now, you do have a dependent life benefit, which is every employee with a spouse or children, the county's paying $1.63, isn't it, Christie? The employee is paying that, to have just a $5,000 benefit on a spouse and $2,500 on children. What we are proposing that you offer is on page 5, which is a voluntary term life benefit. What Christie's also having to get done for those people that want to purchase on their dependent, she's having to get EOI, evidence of insurability, again, if they're over 60. The way this plan works is their guarantee issue. If they choose to buy it, this is on them. This is not anything the county's purchasing. But if they want to buy an additional voluntary life up to $150,000 on the employee, they'd be able to do it without answering any medical questions. They could do $50,000 on a spouse and $10,000 on dependent children. And here are your rate factors here. These are your rates per thousand, which again is just totally, would be a voluntary plan should they choose it.
Does that bookkeeping burden still fall on us?
It would be on a bill. She would just pay the bill.
So I would have to figure my billing.
You would just, no, there's not a rate per thousand bill. You would say, Jane Doe has 50,000 and here's her premium. So
How often would that premium adjust, though?
it does adjust every 5 years.
Every 5 years,
Yes.
okay.
But that is a normal term life, just age bracketed group term life option. Now, I know a lot of people have chosen the Colonial, that they could do this in addition to the Colonial, they could keep the Colonial, this doesn't have anything to do with that. A lot of times people just want to have a $10,000 coverage on a child without having to go through a lot of paperwork and blood work to literally check the box. They've got to have something on themselves, have at least $10,000 on themselves, they can cover all their children, and the child rate is, it would be, to have all your children covered, it would be $1.65, and that's one kid or 15. Have them all covered with a $10,000 benefit.
Christy, how many employees take advantage of additional life insurance?
But they've not been offered it in how many years? No one's offered that to them, correct? The dependent life?
Well, the 84 cents has been offered, but now we've never had an option to have a spouse.
Okay.
Okay. So if it was made available and we promoted this, we might have more people take advantage of that.
The only other thing, there was two things, Brian. One is that I'm assuming we would do that at the same time they sign up for insurance every year.
Right.
So at the time they're talking to them about.
It's annual open enrollment, no changes between.
Okay, so that helps the bookkeeping burden.
But we do still have to, every month, reconcile what's running through payroll, we deduct from the checks to the bills that we're turning right. So there is some work out there, there's one more work.
They would grandfather those that were currently covered underneath your Sun Life plan. That would just be a transition from one bill to another. One thing, Christy, you want to go ahead and say what you're fixing to say?
That we did go to Guardian, I don't have a different enrollment from the other insurance, because we have Colonial, we have the regular insurance. So I like to do this separate.
She was thinking about doing it in October, having just a total life insurance enrollment, offering the voluntary things, let them decide that, because there's a lot of decision making.
The employee needs to be educated at the time we sign up as well, so they know.
Do that at a different time from health insurance.
But make it active January 1, right?
That wouldn't matter. Okay. So you'd have one time a year you had the option to take advantage of additional life insurance.
And the way life insurance works on the voluntary term life, you actually have the initial enrollment, all the active employees would be offered to come on this voluntary life plan when it's initially offered. If they don't choose to do it then if they wanted to do it next year, they would have to provide evidence of insurability next year. But as new people are hired, then they're just given the packet. You would have the rates per thousand. I mean, you actually have the actual rates by rate grid and say, if you want this, it's $5 or 10 or whatever it is, and they would just elect it, no EOI.
Okay.
The only other thing that not related to this portion, of course, I think we're all doing something already anyway, there's some line, but part of our agreement with Colonial a long time ago was that rather than having 15 different companies without insurance, and having 15 different deductions on your paycheck, we would allow them to be the provider for us and terminate and have the cafeteria plan. So that they might feel like that you're cutting into their life insurance.
I could actually, I'm talking to Ron today about something else. If you want me to, I could ask him if he cares, if we just offer all life to people. I mean, like I said, it's not good. What he's generally selling is probably term life. I mean, universal life and whole life is the majority, I think, of what he's selling. But on his, you have to answer the medical questions, and you have to prove insurability. So, and not everybody will buy
The problem you may have is they may switch from him to this.
that's true too.
Then you still have him to handle the cafeteria plan for us.
With this, if your employee leaves, they leave, they're not taking some.
Actually, it is portable and convertible.
Make the new.
Yeah, it is portable and convertible.
Okay.
Yeah, that's,
See, under some life, their employee can't go with, they use that.
yeah, portability included with evidence of insurability, meaning they can take it with them as long as they fill out a form and they want to continue paying for it on their own.
And explain to them that we really already have that anyway, some life policies, obviously.
Exactly.
It runs out, say that runs the cafeteria plan anyway, that's life insurance.
Correct.
You might have a problem with it all, but
And
it does kind of cut into the product that he sells. And part of our deal was, in return for letting him be the one that provided insurance outside of the county,
yeah, and what he's talking about with the cafeteria plan on some things are pre-taxable, some things are post-tax. Life insurance is always a post-tax deduction on your cafeteria plan, simply because you don't want to be taxed on the benefit you receive at death.
Okay.
I'll talk to Ron.
All right, what's next?
That was about what we had.
Let me ask you about one other thing that we talked about, and I think it's always retiree medical insurance, just in general. I checked with, at the current time, if I understand our policy right, somebody that works for the county or that meets the rule of 75 can be as young as 50, 52 years old. They can retire from the county and probably are not retiring from work. So they probably want to work for somebody else. But under our current plan, we still provide their insurance until age 65. I don't think that was the intention of anybody on the court when those rules were passed. But that's a lot of that young that's still working in the workforce, be on our insurance instead of whoever they go work for. I checked with some of the other counties and cities. The city of Mount Pleasant has a 20-year retirement policy, so they've got some people that can retire even earlier than 50. They just have to have 20 years of service with the city. But if they retire and stay on the city's insurance, they have to pay the premiums themselves until they reach age 60. So, I know I've talked to some of y'all about it.
What happens at 60 to 65?
60 to 65, the city pays for their retirement pension, but only between 60 and 65.
Okay.
That's Mount Blue, city of Mount Blue.
And how many retirees right now do we have that we are paying insurance for? 7 to 10? Okay. Well, we had talked about if you were to remove that benefit, not only are you affecting those 7 to 10, but you're affecting employees that have put in a lot of years and that are anticipating retirement in the near future and are counting on that benefit coming up. My opinion, you can't just wipe all that away and be fair. If you were going to do away with this, you'd have to pick a point somewhere, either go with anybody that's not vested, we're going to change that, or any new hires, we're going to change that, but I don't want to see us strip away that benefit for anybody who's an existing retiree or...
But here's the point. We are a self-insured plan.
Right.
I don't know if anybody out there, I'm looking to retire too, but there's none of y'all that will retire at 52, I don't think, never worked. So, under the new requirements for every employer, insurance is going to be provided wherever you work. So, they're not telling you when you leave the county at age 52 that you're not going to have insurance.
I disagree with that. I'm not going back to work.
You're not 52.
Okay, hold on, we got to maintain a little bit of control here. Let Carl finish, please.
Well, the part-time is not covered by insurance service. We don't provide benefits.
I'm talking after the retirement.
Well, you just have to understand, you have to try to work with what's best for everybody. No, I just don't think it's reasonable to expect people to retire at age 50.
What would you offer as an alternative? Something like the city of Mount Pleasant does, where they would, if they choose to leave early, that they would pick up the tab on their insurance up till age 60. The county would pay for it 60 to 65.
58 or something, yeah. I just don't think that was ever the intention, was for people to retire at age 50, because I don't really think anybody retired. I don't think anybody's going to be told them at age 50.
Yeah. Okay.
There's not anything wrong with that, so you can figure out how to do it, let me know. They would love to be able to figure out how you can retire.
What research did you do to determine that was the best for everybody? You said that's the reason.
Well, I'm talking about best for the taxpayers as well as the employees. Well, when you're a self-insured plan like we are, it could cost us $50,000 or $60,000 a year. It's not just the premium we're paying for you. It's the cost of the procedures that you have done. So we pay all the bills until.
Yeah, and that's something I'm not sure everybody understands. This isn't a matter of simply picking up a Blue Cross Blue Shield premium every month where we know exactly what your insurance is going to cost us from the time you retire until you hit 65. The county actually writes a check to pay for every claim that you have. If you're real sick, it's real hard on the county, so it's not just pay that $1,000 a month or the $900 a month. What was it, $750 a month?
And it's possible, we talked about that too, that when it comes to retirees, even at age 52, if that's the way we want to do it, then let's try to find them a policy, like a Blue Cross Blue Shield policy. Then at least we know how much we're out of pocket. If it's going to be $1,000 a month, well then we know it's $12,000, but it's not. But it could be under our current plan, $60,000 every year if you get sick and for a long period of time, 5 or 6 years, and we have to pay for the payments.
Okay, here, let me set some ground rules. If you want to talk, I'd appreciate it if you'd stand up or raise your hand or something, and I'll be glad to recognize anybody here, but I got to maintain some kind of control. I don't expect anybody here to say, oh yeah, that sounds reasonable, I'm happy to give up my retirement insurance. There's not going to be one person that's going to support that. We're simply discussing ways where we can curb the continuing increase in our self-funded plan. I still think our self-funded plan is superior to a Blue Cross Blue Shield policy, but nonetheless, we have to maintain some balance. We want to do it fairly, but again, we're just discussing. Okay. Ken?
Your Honor, can I ask why we are preferring to go with a self-funded plan instead of going with Blue Cross Blue Shield? I've had the unfortunate misgivings of my son had to have surgery this year, and my wife has also had some stuff. We've had some pretty high medical bills, and we haven't reached deductible yet. And it's because the negotiated discount that the CAPS is paying is nothing. And I don't know why we're not going with Blue Cross Blue Shield or some kind of plan like that.
Well, first of all, we've had a self-funded plan. This is nothing new. How long have we been self-funded? Early 90s, 80s?
25.
Okay. This isn't a new plan.
I understand that.
Okay.
The posing is, why aren't we going with something like that? That way we know what the insurance costs are.
Well, you know it a year at a time, but as your history proves to cost Blue Cross Blue Shield more money, they keep raising those insurance premiums. And coming from a situation where I used to pay for my own personal Blue Cross plan, I saw that thing take 15, 20% jumps every year for years, where finally I had a $10,000 deductible. So that's one of the reasons you don't go with them, is because you have no control on where that premium can go.
In response to that, Your Honor, we're not reaching deductible. They're not paying enough, and for us to reach deductible.
I guess I'm not understanding what you mean.
For instance, my wife had a procedure done, and it was about a $4,000 procedure. Their negotiated discount was zero. So you never get the deductible. You're out of pocket, and I've got the documentation that I can show you on that.
Does that make any sense?
No.
It's a take it or leave it plan that they provided, from what I understand. And I can show you those bills, but what they're doing is not paying for anything. And if they do pay for anything, it's pennies on the dollar.
Okay. Well, first of all, before we start throwing rocks at CAPS Insurance role is our advisors and our consultants. It's this Commissioners Court that decides how the plan is written. CAPS will pay 100% of every person's medical bill here if that's what we tell them to do.
I'm not being critical.
Okay.
I'm being critical of what we're under right now.
Okay.
And
I think what you're saying is not the discount rate, but the disallowing period.
no, it's the discounted rate. It's what they negotiated with the hospital.
That shouldn't have any effect on your deductible.
We never did deductible. That's what I'm telling you. Is that anybody, I guarantee you nobody in this room can see deductible.
Well, all I can say that is you on our office and kind of working through that is, number one, if the carrier, the discounted rate, you're not, they cannot bill you for that, for the contract.
Correct.
Okay, now that may not be what they're doing, okay? But in the absence of that discount, you're getting your deductible at hurry, okay, which is money out of your pocket. You see, so I'm just saying that you need to come by our office and let us sit down, we can work through those bills and stuff, because there may be something on there that,
But bring the EOB, don't just bring the bill, because the evidence of insurance, the thing that UMR sent you is the document that we need to know exactly how insurance applied the claim, because you could get billed anything, and what Steve's saying for you is like if the claim is being reduced to zero, then ultimately you can't be billed for that because.
unless it's a procedure that's not.
We can't be kicked out of the hospital, correct?
I'm sorry?
But we can't be kicked out of the hospital because our insurance is paid. Is that correct?
I don't know.
Okay.
I would encourage you to come by our office and let us work through that.
Let me say this, I know back in, earlier in the year, we had some problems, and I got frustrated too about it, but Tony has worked on it, and Steve's worked on it, and a lot of it's the concept of the doctors and the hospitals. They don't seem to understand that y'all are hired to handle and pay bills, that we are not URM. It's two different things. It's separate. But I do know that the bills eventually, and it took a while, let me tell you, couldn't do it overnight. And I know Tony tried to explain to them, and it was hard. We're going to have to educate the doctors and the hospitals and people. These are two different things. They're not the same thing. And in their minds, it was. But I do what, Steve, if you get a chance, I take them over and let him sit down and look at them, because that helped me more than anything else understand some things. And it's frustrating sometimes when they don't pay the way that things have been being done.
You know, I would encourage any employees, before it gets to that frustration stage, give us a call.
Steve, negotiating down the hospital bill, that shouldn't affect your...
That's a good thing.
It's a good thing,
It's
exactly.
a good thing. They can't balance bill an employee for that under contract. Now, that doesn't mean that sometimes they might not try, but I don't know if I'm just a hospital. You know, sometimes providers, they'll see a balance, they'll send a bill out. And sometimes take a phone call and say, hey, that's a good negotiation.
Yeah, good point.
So,
Good point.
you know, most of the time we find that there's something that the provider, maybe when they file a claim, coded something incorrectly, but it could be a procedure that's not covered under your plan. It's an elective procedure, cosmetic, and I'm not saying yours is, I'm just saying that sometimes that can be the case too. So, but certainly before it reaches frustration stage, we want a phone call to do some work to it.
Well, comparing the current plan with the previous plan, I can't think of any area where this is a substandard plan over what we had with Health First. Yes, the deductible did go from $600 to $750. As far as I know, that's the primary negative. Now, as far as if somebody's being disallowed on a particular procedure or not, chances are they would have been disallowed under Health First, right? Okay.
There was a little bit of transition, that process of what we call stream benefits, when, all your folks gathered with our folks and talked about all the benefits, like I have an x-ray, if it's done outside of the doctor's office, that's not the way it was done in the previous plan, we got that fixed, and that was just part of that transition. So, I know from our perspective, I think our calls have pretty well settled down. I mean, we certainly welcome any kind. We don't.
Okay, Daisy, I'm going to recognize Chris next. Chris? We'll come back to that. Daisy?
I just want to say that I went out a shop back in February, and last week I received a bill where it was not been paid.
Okay.
I got all the shot.
Well, here again, I'm going to direct you to see CAPS and strongly encourage that you do that, because if you find a problem that we've got here, it might fix a problem for 10 other people. So give Tony a call, Tony Melton at CAPS Insurance, and share this with them. I can't fix it, but they can.
In the office, there's 5 other people there, so you don't have to specifically talk to me. So
Okay.
we do have 5 other people there. But you can't answer me, but if I'm not there, don't wait until I'm back.
Okay. All right, Judge McNutt.
Have we renegotiated with the Texas Medical and Fire for this year? Have y'all got the contract with them?
Not sure what you mean.
You're talking about...
Nothing's changed.
Okay, are they going to? Because they did not provide services at these Texas Medical and Fire.
And
in Pittsburgh.
That was one of the major changes of going with UMR. We increased our benefits up here locally at our local hospital, but because of East Texas Medical not being a part, are they not a part of the what's the word I'm looking for?
United Healthcare. They're not in United Healthcare's network.
Okay, they are not in United Healthcare's network.
It's not specifically to Titus County. There's nothing that you can do, because that's the nationwide United Healthcare
Okay.
network. And it's because United Healthcare has a contract in place with the other hospital in Tyler, Mother Francis. And the big hospital, ETMC, basically there's a power struggle there between those two hospitals. I do know that they have started discussions with ETMC. United Healthcare would love to have the big ETMC in their network, and I do know that they have continuous conversations with them. Whether or not that happens or not, I can't tell you, and it's out of our control.
ETMC chooses to pour all their great discounts into Health First, which is their own company.
Correct.
Yes.
So I've got a question. I have back issues. I have degenerative disc disease, and it's not ever going to get better. I had 3 surgeries last year, 2 on my back and 1 on my neck. And the only doctor that would even try fixing me was out of Houston, which Health First paid for every benefit. It was $89,000 for all 3. And I only walked away paying $1,200. So if this happens to me in 5 more years, are you telling me that I have to come to Mount Pleasant to have back surgery?
No.
You have the healthcare network, nationwide network, usually.
So y'all would pay if I ended up back in
You
Houston?
just got to go to the network physician to get the best benefits, so you get the network benefits.
That physician may be in the UMR network. It'd be good to give them a call and find out. But no,
Well, I guess I was misunderstanding.
Yeah.
I thought locally, we would have to go locally.
no. Health First, because they owned, or because East Texas Medical Center and Health First were very much interrelated, Health First gave strong discount benefits to East Texas Medical Center hospitals, wherever they might be. When we changed to UMR, that benefit went away, but instead our local coverage, as well as there's a whole lot more physicians and medical facilities that are now in our network than were previously. So nothing to say that your doctor isn't part of UMR, I don't know, but you might want to ask, just so you will know.
It's not UMR, it's United Health.
United Healthcare, sorry. UMR is the administrator, right? And United Healthcare is the coverage. Okay, anybody else? Next topic? Anything else?
The question had come up, I think, at the last meeting about the local prescriptions having a 90-day supply. Chris Kalfendor replied back and said that you do have a local, it's called Retail 90 in place. You just have to have a prescription that is written to dispense in 90-day quantities.
Okay, let's make that clear. If you go to your doctor and you're on blood pressure medicine, you take it every day of the year, if you can get your doctor to give you a 90-day script, take that to...
Pay the 3 copays, but you can get a...
Pay 3 copays, but you can get it all at once.
Right.
Okay.
If it's written as a 30-day prescription, where you're just taking it,
They're not going to give you 90 days on a 30-day prescription. Okay. Now, that is a difference over Health First, in that Health First did allow some 90-day prescriptions with a single copay. Is that right?
And we had changed that.
We had changed that with Health First?
Yes.
Okay. Okay, you're right. You're right.
she said,
Well, I thought the county had to pick up those extra co-pays.
I couldn't hear you. What?
I said, I thought the county on those 3-month supplies, didn't the county have to pick up those other 2 co-pays?
No. No.
so with one copay, you want them to get a 90-day?
That's the way it was before, so I assumed that we want to leave it.
Well, that was one of the things that we gave up when we changed insurance. That was another concession that we made, as I recall. And I don't think under Health First,
We had changed Health First before we ever left Health First the year before. That had changed.
back in 2012.
Yeah. You could only get the 30-day, and you pay that copay. You couldn't get a 90-day and pay one copay. That had changed in 2012.
I mean, they'll do it however you want to do it, but that's the way it is.
Yeah, that's the way it's in place. You can get 90 days with a 90-day prescription, but you must pay 3 copays. And again, with the free generic, or is it $5? Is it free generics? $5 generics. So with the generic, you'd pay 5 times 3, you'd pay $15 for a 90-day supply. Okay. Chris, let's go back to the retirement issue.
if somebody has a pre-existing illness, sometimes it's hard to get insurance with that. And if somebody retires at 52, 59, or whatever, it's going to cost them a lot more. Now, whether you do away with all the insurance, that's up to you, but, consider giving them the option of maybe paying half of the premiums. So that if they do, those who decide to go work again somewhere else, if that insurance is better, then they have that option. And then they can find out if that insurance will take them with that pre-existing problem. But to completely wipe that out is not, to me, in my opinion, saying thank you to that employee for giving you and the county their time.
Okay.
You've taken away benefits for the reason that they stayed with you for the county for that amount of time.
Thank you. Paul?
To add to that, what happens in other retirement situations is basically when you retire, you are able to take your insurance with you, but generally retirees do pay a portion of that premium. It slides based upon how much the county can pay. Sometimes they'll reduce it, sometimes they raise it. But generally in retirement situations, they do pick up more of the premium than they've done than just to get a free premium out of it. It allows you to retire early because you carry your insurance with you, but you know you're going to be paying a little more if you retire early. If you go to work someplace else, like I did, then you may want to go with that new insurance as opposed to keeping your old insurance. But I'm just saying that you really wouldn't want to take it away from them entirely. What you want to do is the ability to move that up and down a scale as to what the county can afford to continue with the retirement.
So at least they have the protection, of staying within that group rather than being kicked out to where they could very easily be denied insurance. Yeah, no, I agree with it. Well, again, and to clarify this point one more time, we're not simply talking about, and I'm not arguing you, I agree with you, but it is not simply a matter of paying a fixed premium on your behalf when you retire at 52 years of age. It is a matter of the county saying, we're good for all of your health claims from here on out. And of course, the older a person gets, theoretically, the higher their medical expenses are going to be. So here we are agreeing to cover with a self-funded plan all the medical expenses of typically an older class of people here. And that's where the burden is magnified on the county because of that age differential. And so that's why we're addressing this particular issue. If it was simply a matter of, well, now they're going to, we're going to start paying part of their $1,000 a month premium till they're 65, well, at least you could quantify that. But under a self-funded plan, you can't quantify that. It's, well, we're agreeing to cover you when you have that, heart bypass.
All I'm saying is the employee could pick up some of the cost.
Yep, and I think that's a good point of discussion. Okay, Deborah?
I've been here for 30 years. I started when I was 20. And I'm 51. I can retire. I would like to work a few more years. And I don't think that it's right. Okay, I retired and I might work part-time somewhere else. If y'all was to cut and I would have to find insurance, well then yes, I would have to work a whole full-time job just to pay for that insurance. And I don't think it's right that I put all this time in and then go home and then I would have to work for insurance.
Right. Thank you. I saw somebody else's hand. Yep.
Well, these people that's been working here for quite some time, some of them have came over from other agencies, they may have come to work for the county because of the benefit packages they have. They basically signed a contract with the county saying, okay, when I retire, they're going to cover my insurance until I reach 65. That's what they signed on for. So now taking it away from them, I mean, that's just not right. It wouldn't be right. Regardless of when they get retired, my myself, my family history, my father died at 59. I had an uncle died at 60, one at 66, my grandfather died at 65. I don't want to have to work till I'm 65 and die. My plan is to work till I'm 60. Okay? But I'm not going to be able to work till I'm 60. I'm going to have to work till I'm 65 if I'm going to have to pay my insurance from 60 to 65. There's no way I can retire because I had to work for insurance back then. So,
Well, I don't think of any of the plans that we've talked, that we've discussed this informally. It's not because you retire the insurance out totally. It's to, if they go get another job after they leave here, then just like any other job, you're required to get your insurance.
But if you have a good place to work and you treat your employees right, they're not going to retire from you and go work somewhere else. They're going to enjoy their job and they're going to put their life into this job. That's right. But if you start cutting and it's costing them money every time they come to work because they're, Ken's family's sick and it's costing him, medical bills and he's not getting any help with his insurance. And, you have all these little different things and we all realize times are tough. But you're talking about saving employees money or saving taxpayers money. These are taxpayers too. So,
I can't hear you.
I said they're also public servants that don't work for a very high wage.
Did you want to say something?
Yes, that's well, I just wanted to pretty well back up Chris's statement that I've worked here since I was 25. I just turned 25. I stayed with the county. Yeah. I stayed with the county all these years because of my benefits. I knew that I was going to receive because what they issued and what they promised us. I could have gone and I could be making a salary of $25, $30 an hour. I've had job opportunities. People that asked me to go to work for them, but they couldn't give us the benefits the county issued us. That's my stay and getting all my life,
Okay.
I'm young, I'm old now.
No, you're not.
Strictly for the benefits.
Okay.
How long have you been here? 28 years.
Okay. All right. Well, any commissioners, feel free to jump right in here. Marcus?
I mean, and I'm talking about, also what Chris said, I came over to the county not because of a pay raise. In fact, my pay actually went down. I came because of the place that I work for and who I work for, but also the benefits that I was offered. The good retirement, the good insurance. But if those benefits start decreasing, then I think you're going to have a hard time keeping the good people that stay here 28 years. I plan on staying here quite a while, but at the same time, I can go somewhere else and make $60,000 a year, $20,000 a year more than what I'm making here. But I choose to stay here because of who I work for and also the benefits.
Yeah.
Start taking away those benefits from the people, and you're going to start losing good employees.
Well, I think you're right. First, and let me say this. I don't want y'all to feel like you're here trying to convince us of a decision we've already made, because we're a long way from that. We bring up a lot of different topics as we're discussing this, and I don't think that there's anybody here that doesn't understand the point that you're trying to clarify. And so when we talk about taking something away, that's tough to do. And I personally don't support taking that away from those that have been counting on that. I would like to pursue other alternatives where we pick a point and we say either from everybody that starts now or anybody that is not vested, or figure out some way if you're even going to consider doing something like this. But again, there's been very little discussion on this subject. This is just a day that it is here for a topic of discussion, and we've heard you. Yes, ma'am.
I would like to make a point on another side of it is the liability aspect of it. I know these employees are talking about them specifically, but whenever you get somebody that has a high turnover rate, you may be filling that position with somebody that might not be as qualified
issues over in the public servant sector, that if something were to happen and there's not a responsible employee to take care of that situation, that's going to cost the taxpayers possibly millions of dollars. And we've actually had 2 of those instances since I've been in the sheriff's department. So we can also save the county money by making sure you've got quality employees as well.
Okay, thank you.
Judge, this is one other thing, I've been on interview boards and things of that such, and I know how hard it is from the sheriff's department's side, how hard it is to find a good quality employee. We might interview, I don't know how close the statistic is, but we might interview 10 people, get 1 qualified applicant, and that's not to say that when the applicant goes through our process, he's gonna make it. So it's hard enough just to find a good qualified employee, but it's even more difficult to actually keep that employee. You know, keep them happy, and keep them.
All right, thank you. Let's go back, go ahead.
This hasn't always been a benefit either. It was added about 11 or 12 years ago. So it's not always been in the retirement.
Okay. And prior to that, was there anything, if you retired, it was over with?
That's right, you just retired, you got your retirement. This was added about, I don't remember, if it was 11 or 12 years ago that it was added retirement.
And what was the idea behind there? Do you remember those discussions enough to?
I don't remember, I just remember that.
Okay.
Maybe we wanted to cover the gap for when they retired and when they
Okay.
I think when we did this, we was looking at 60, we was thinking 60 to 65 is, you know, when we were thinking.
I was right, we were to offer this the last year, check about the minutes and see when it was approved. It wasn't here when I got here.
It was 11 or 12 years ago.
Well, let's get back and focus on what CAPS is here. CAPS has brought us a couple of topics here. Let's try to make at least some decisions on what they've brought to us. We started off with life insurance. And one of the significant changes we're talking about doing is reducing life insurance for those that at 1.5 times would now only have $50,000 in coverage, no?
You're capped at 50 already.
Capped at 50 already, okay.
All you're doing is increase the benefits for everybody.
Okay, increasing the benefits for everyone that doesn't have 1.5 times equals $50,000 and bringing everybody up to $50,000 worth of coverage. All right?
Before, I would like to get Colonial over here and talk with them and kind of go over what we're talking about here, because I don't, you know, they have a cafeteria plan, and they're the ones that go in here, and they're going to be doing all this paperwork for y'all.
This particular plan is already in place. They don't have a problem.
Right.
Just say he wanted to go through the cabinet plan.
But you were looking at adding some other things there.
The other part we're talking about adding.
Well, you've got 2 different things. You've got basic life, and that's what I think Judge Lee was talking about now. Basic life is would be everyone having the same 50, you can proceed without having to calculate what that amount is. And because that is a moving target, because when people get raises, that does change. That way everybody would know they would have a flat $50,000 in life insurance. The basic life does not go through the 125 plan. It's only the voluntary life option, which is just an option. Although Guardian did assume that it's being sold together, so that could raise, if you chose not to do the vol life, Guardian, you know, might raise those rates.
Will you visit with Ron and kind of let me know what his attitude is? The second thing we're talking about is there's one place where benefits have increased. To those at the lower pay scales, they're now going to have flat $50,000 along with everybody else. But also we're raising the situation where somebody hits 60, their benefits start to deteriorate, their life insurance benefits start to deteriorate, where now under this proposal that would not occur until age 70.
Correct.
Okay. All right.
But you are going to get with Ron and kind of look at that. I just want to be sure on that, because they've been doing this a long time, and I think they've done a good job, saved us a lot of money.
All right. Anybody want to discuss the subject of deductibles and co-pays?
Okay. Well, the deductible, I think we have a cap on that, but the we're looking at 750, you're looking at going 1,000. These county employees have had one raise, and this will be the 4th year. And I think we need to leave it where it's at. 750 to me, we went from 650 to 750.
Well, in light of the fact that CAPS quantified it for us, that if you were to change the deductible from 750 to 1,000 and reduce the copay from 90 to 80, you would save the county $18,000.
Yeah, $600,000 claims.
Okay.
I don't want to change either one.
Okay.
Leave the 90, 750 all the time.
And your variables for doing, you don't have to do those together. He just gave you those.
Right. But I think those are two significant psychological, and real increases where we're talking about quite a bit more money out of folks' pockets.
And what you're looking at here, we go from you're talking about going from 90 down to 80. The 90 is to encourage the people to go to our preferred people, but they don't have to. They can go somewhere else. And that's an incentive.
More steerage.
But when you talk about 90 to 80, it doesn't sound bad, but when you talk about 100% more out of the person's pocket, because if they pay $900 out of their pocket for a $9,000 claim, they're fixing to get out 18.
No, that's not, no, we stood, the out-of-pocket, no, the out-of-pocket's capped at $3,000. So either, no, sir, no. You only, once you get the $3,000 out of pocket, you're over. Okay, so it's 100%.
If it's a $10,000.
Oh, yeah, well.
It's a $10,000.
Well, I see what you're saying, yeah, it's an in-between claim, and that's true.
So they're out
That's
of
true.
1,000 plus 9.
Extra 10%.
Plus another 10.
Okay. Ken?
One point that I wanted to clarify is the problems with the insurance is what I've been seeing on the bills are the negotiated discount is about 10% of the actual bill. They're not paying like 90% of the bill. When we start talking about deductible, UMR is paying a very, very small percentage of what the hospital's billing. So, like I said, on that $4,000 procedure, the negotiated discount is zero. And then you'll see another charge where it's a $500 charge, and they've negotiated it down to $10. And that's the problem that I've been seeing. That's how you don't get your deductible. And anybody, I guarantee you there's nobody that can see a deductible.
Nobody's hit deductible. Anybody here hit their deductible? Okay. Okay. Are these, how would that have been? Do you have an opinion as to how that would have been under Health First? Okay. I'm going to ask both of you, if you'd like to bring some of your bills in and let CAPS take a look at it. There's something here that doesn't sound right.
And I'm not down to scales and all. I think that they try to do as much as...
I understand. Will you pick up your paperwork and take it and let them take a look at it? And I'd like to know, what the outcome is. Do we have an error? Do we have something that's so radically different from Health First that we need to address it? Or do you have procedures done here that would have been disallowed under Health First or under UMR? I don't know what it would be.
That's not it. That's why
Okay.
you can see Tyler's not picking up on their claim is because they're not paying anything. That's why they won't contract.
Because they're not in the network.
No, it's because they're trying to negotiate a discount and get a contract with ETMC, Tyler.
Well, but they're still not in the network.
Right.
Okay.
And the reason that they're not in network is because they don't, UMR doesn't pay anything.
Okay. All right. Anyone else? Okay.
I'm just going to say one other thing. You have a good year. You might say that deductible change, those benefit changes for the bad year that we know might come.
Yeah.
We're certainly not.
I agree.
That you make those changes.
I agree.
This is probably one of the best years we've had in a long time. I know in some past we've had some, and those should be put in kind of a pool for those bad years that you have. But, right now, our employees, we're looking at going up on stuff, and they've just had one raised, and like I said, the last 4 years, and I think we need to I agree with Thomas, we need to leave it where it's at.
Okay. Anything else we need to discuss before we let you go?
No.
Okay. I appreciate y'all coming in very much. Thank you.
Thank you.
I just want to say this, why is it that they want to know whether we have another health insurance or not? I went to Dr. Greco, and about 3 weeks later, they called me and said when they filed for my insurance, they wanted to know if I had a second insurance. So I had to call this number, and all I did was do an automated deal. And then when I finally talked to someone, I had to call the bill, and I talked to someone, and they said, well, yes, you have to do that every year. Let them know that you don't have another health insurance. Why is that?
That is to, what they call coordinated benefits. They have 2 plans. It used to be, a long time ago, you had 2 plans, like on both plans. Well, they want you to do that. So they want to match up. If you have another plan, say your everybody cousin's plan is, they provide service or whatever, then they want to coordinate those benefits. And they basically don't want to be paying double.
But no one ever told us that, because I was not at all anyway, but nobody would do that.
Yeah, I think everybody.
Well, that's a new requirement. It requires 1 phone call a year, right? Okay. And once we know that, then we can remember to do that, and we'll remind everybody when renewal comes around.
And that is designed to protect the county's money.
That's what keeps our costs low. One more thing. Okay. All right. Thank you, Tony. Thank you, Steve. Thank you, Brianne.
Thank you.
All right. Thanks, everybody, for your input. Okay. While we're on health insurance, let's one more time bring up the subject of life insurance for juvenile probation so that we can give them a firm answer. We've told them we were going to, what's that? Medical insurance. Did I say life? I meant medical insurance. Okay. Anybody here from juvenile probation? No. And again, juvenile probation is currently providing their own insurance. They're seeing their premiums continue to go up, and they have asked to become part of our health plan.
But they're really not, the state's giving them money for their insurance.
They're reimbursing them.
Reimbursement.
Right. Okay. And they would, if they were able to get under our health plan, they would continue to reimburse them. Although they're just going to reimburse them for the imputed cost or the accrued cost of our health insurance. They're not going to reimburse for actual out-of-pocket claims. Mm-hmm.
Or they might do reimbursement overrate, so they actually charge people that's a little higher.
Yeah, I would doubt it. I would doubt it.
At this time, I don't want to do that.
Okay. Just soon leave it like it is. All right. Okay. All right.
We're going to leave it at 90 and 750.
Yeah, if you're ready to make a decision on that. Well, we're not taking action on these. This is just discussion at this point.
You can kind of get a consensus.
Okay. All right.
90 and 70, yes.
Let's bring up the retirement plan. Right now, it's my understanding, we are at the very maximum that we can be. We are asking for a 7% contribution by the employee, and the county elected at some time years ago to go with the maximum match, which I'll call a 2.5-time match, a 250% match. That is the maximum. The options that we have would not include raising either of those amounts. The options that we have that we can consider would be lowering the employee's match below 7% and or lowering the 2.5 times multiplier of the retirement plan.
Excuse me for interrupting you. When we met with them, did we tell them we wasn't going to change this coming year? When we met with the retirement representative here, we said we wasn't going to change. We was going to stay at the same.
That's right. When does that year begin?
It's December, is it not, Carl? January 1.
Okay.
We said we wasn't going to change.
For 2014? Okay.
You know, I don't know if we need to do it.
Well, one of the things that I wanted to come out of this discussion was what Carl found out in talking to, we picked City of Mount Pleasant as a comparable. City of Mount Pleasant has is it a 7% match? I don't even know what, they have a 7% match. They've gone with a 2-time multiplier. They also have a cost of living adjustment built in, which we do not have. And our current year contribution is going to be about, or for the upcoming year, is going to be about 11%, up 11.17% county contribution, which is up from about 10.5% over the previous year, whereas the City of Mount Pleasant is 16%? Right now, we're in the year that we're in, we're at about 10.5%, and it will be going up to 11.17. Again, the increase to the county continues to rise and is expected to continue on up, as I remember that chart, somewhere around 14 to 15% before it's all over with. And the reason there is because of the poor performance of the stock market and lower interest rates that we've experienced over the past years. So in the defined benefit plan that we have, because we make guarantees as to what the county will pay upon retirement, any shortfalls are having to be made up in the form of increased county contributions. And we don't have the ability to make a change to any new employee. We have to maintain consistency with that plan. So the only changes that we even can consider are reducing employee contributions and reducing that 250% match. Yes, we are committed for the 2014 year, but again, I just like to bring that topic up. And anybody else, anything you want to add to that? Okay.
Well, I know the stock market in the past 4 or 5 years has not done well, but here lately it's done extremely well, and it looks like to me in the future that could turn around.
It's not just a stock market.
I understand. There's other variables there, but
The interest rates are a real drag on any retirement plan.
But I thought I read where they did really well on this retirement, whatever they're invested in. I thought that's what I saw in the last figure.
But they had a couple of years that were good, and the interest rates were
That's what everything.
One subject that came up at some time in the past was, right now employees are required to have 7% come out of their paycheck that goes toward their retirement plan. Is there anybody that would consider or would want that to be lowered, understanding that that would affect your ultimate retirement? Okay, all those stand that are in favor. Okay, I didn't know. None of us knew the answer to that. If given an opportunity, would employees elect to have less than 7% taken out? And the answer, it sounds like, is no. We understand that the more we put in, the more we get out later on, and we don't want to change it. Okay. All right. One of the topics I wanted to bring up was allocation of travel expenses by department as opposed to allocation just completely to the general budget. And talking about travel and seminars, having budgetary limitations that are set by that department head rather than just having one large pool there. Is there any advantage? Are we going to improve efficiencies by allocating that on a department basis?
I guess technically, if you give, how we did those days, if you allocate it to the elected officials, they would turn it report to you or anything else.
The reason we changed, so there's no control when they win, they just go and spend whatever was in there.
Well, that's the downside to it.
Well, you control it at budget time, though.
Yeah, you can do that.
The pro to it would be that you wouldn't have to go through the court approving all travel. The downside is that you leave it up to these different elected officials, and we have in the past had some that.
I don't know why that's a downside because we approved it. Why would that be a downside?
Well, just takes.
Just one less thing to do during Commissioners Court. I'm not sure that's a big advantage. If we're not going to reap any significant cost savings from doing this, then, it's a moot point. But I'm just wondering if we would gain some efficiencies by requiring that each department head set their own travel and seminar budget and adhere to that. What's our total travel and seminars budget for the county-wide? 40,000, 50,000?
That's countywide.
Okay.
Pretty efficient.
I'm not in favor of changing it, my personal self.
All right.
I agree with Thomas on that. I think it's very efficient. I think if somebody has to go, I know a lot of these elected officials and the employees out here. Last year we had, with an emergency management deal, our hands had to take these classes, and then our foremans had to take some advanced classes, and that was something I was not counting on. But you're not looking at a lot of money. I know they have 4 or 5 county judges, county commissioner deals during the year, and we go to 1. And that's not to be going to 2 or 3 or whatever, but you can go to 1 and just have 1 that you can get all 16 hours at. Another good positive thing is out here at the county extension office, every December we have a class and we can pick up 6 hours, and we're just looking at the cost of that is a big plus, because if you happen to be sick or wasn't able to go to a class one day or something like that, you'd have to go off somewhere else to get that class. And this is not something they ask you to do. You're told to do it, and if you don't go to those classes, you can be removed from office. And your employees, if they're not trained to get the training they need, then and do those things proper, they can cause a lot of headache to your office. So I think the way we're doing it is fine.
Okay. My assumption is there's some people in the audience that are here to talk about travel allowance, so that's one of the topics that I definitely want to hit on. Is there another subject that we need to hit on here that you folks are interested in? Have we covered some of the main ones with health insurance and life insurance and retirement? Any other topics? Okay, well, why don't we talk about that? We'll talk about that, and we'll pay raises, travel allowance. Is there anything else? All right. I'll just open up the floor on pay raises. All I'm asking, just raise your hand, and obviously keep your comments brief. We understand. Everybody wants to have a pay increase. That's obvious. And you know the constrictions that we deal with on a regular basis. But if you'd like to give us, a minute or so, half a minute, we're happy to hear you. Sir.
On the pay rate, if we get one back, I guess, most of the question, I like the way they did last year, where you just give a set amount, and then it actually worked out better. for everybody.
Rather than a percentage, a flat dollar amount. Okay.
The extra, the whole thing, they're not making good ones.
What do we give, $100 last time?
Give them $100, $1,200 a year, I think.
Y'all like that better?
Okay. Woody?
Well, I'm like everybody else as far as the pay rate, but I would do it without pay rate for benefits. That's the main thing to me.
I missed what you said there, but you do without a pay raise if what?
If our benefits are cut, I've been here, well, this will be 21 years. Our insurance has been the worst it's ever been. 21 years. Like Ken was saying, a lot of stuff, and it's not preferred, or it's not on the list. I think it's a generic, well, it's not a generic. There, you have to pay the regular price. It's just when, you know, the benefits, like Thomas said, they did the retirement bill for the insurance 12 years ago. To me, it was because the county at the time couldn't afford to pay the good salaries to bring people in, just like the holidays and everything else with benefits. When you start taking all that away, you're not going to have anything. You're going to have a deputy. I've been there before. We had a deputy that was coming in just to get 2 years of training where he could go to Dallas. And it was just a constant turnover. And the county was basically paying 2 salaries for 1 job. So you always had a deputy training. Pay raise is great, but the benefits we more
Okay.
Could I say something?
Sure.
I know this is not going to please everybody, but the average pay of a county employee is about $35,600. That's what it shows on the thing for 2012 on retirement plan. That's right. The average employee for the workers in Titus County is of $23,000 to $24,000. Now, the reason, I don't know, but I do know that these taxpayers that are struggling should not have to reach into their pocket and pay $10 more a month, or whatever it is, $10 for more than, $80,000 value on their property, when they don't have near the insurance that the county employees have, they don't have near the retirement the county employees have, and I just don't feel like the county employees should be that much different from our taxpayers, the ones that's paying our salary, the ones we were working for. And then...
Okay, hold on.
Let me finish. And I don't think that it's the people out here in this audience that are doing it. I think the problem is the top salaries in this county. I believe that the $10 or $12 an hour people, which a lot of you are, need a raise and want a raise. And I agree with you. But we have, and I can't say this without saying the thing about this auto allowance. We have people in this county that make, for instance, Paula Dyke makes $44,000 a year, but she gets $72,000 a year auto allowance. And
Wait. How much?
$70 to $100 a year for auto allowance, which we take out Medicare and Social Security. That's 8% more. Clevie Williams gets $65,000 a year. Their commissioners get $70,000 a year. And they get $6,000. There's $133,000 in car allowance. I've been a commissioner for 7 months. The most, I've kept up with my miles diligently and charging 56 cents a mile from the IRS for the miles I've traveled. The most I had was about $500 a month, for 1 month. Less than that, it's been less than that every month. And that time I had to go to Tyler to look at a motor grader 2 times. So the point is that this is nothing but salary. If you add the $133,000 that our officials are getting, elected officials, onto their own salaries, that differential between what the low-paid employees make and the $35,612 would be even greater than the people. So it's just a matter of where do we need to make the cuts I don't think it's the people making $10 or $12 an hour. I think it's for the people that are making $70,000 a year and $60,000 a year. This is my opinion, and I couldn't get it say without me.
Let me say one thing about your car allowance. I've had about 6 or 7 calls from people in your precinct that say you need to start spending some of your time driving over your roads, that you're not traveling the roads.
Okay, be glad to recognize you in the audience. Thank you, Clevie.
I'd like to make one reply. I think going back to salary is not $65,000 a year. It's like 56, but I think what he's saying about my car allowance, I have a car allowance on my personal vehicle. I also have a car allowance on a reserve patrol car, which is around, I think we reduced it this year to 1,000. Maybe that's what you're thinking. I mean, I don't have 2 car allowances, sir. I have one. My deputy has a car allowance for his patrol car, which he averages $2,000 to $3,000 a month in tickets and citations. He works 30 to 40 hours a week. He doesn't get paid one dime for it. He's been doing it for 10 years. Mr. Jewel Lee, I appreciate it.
What do we use those 2 cars for? The constables that volunteer deliver most of these things around, we just got them sitting over there, or what do they do? They don't do anything? That's a question.
What might have to be done, sir? He gives out service warrants. We have a lot of warrants. We get all the highway patrol warrants now. They don't have time to serve them. We're out serving that. He is also a certified mental health officer. We're out talking to the people. We're working 2 different cars most of the time. Now,
The constable,
offender will go get it.
and then the 15.6 is for what? For your personal car?
My patrol car, where I take people to Terrell and patrol their county.
You fill out mileage when you go to Terrell.
Yes, sir.
All of these people on car allowance, the public needs to know, and that people on these car allowance that get this 15.6, when they go to Austin, these commissioners, they've put down 56.5 cents a mile. Everybody does. When they leave town, this is just for driving around town.
I don't get mileage for around town, sir. It's just when I go out to the county.
Yeah, right. You don't get the 15.6 when you go around town. Look, you should be reimbursed. Everybody should be reimbursed for the expenses they get on their car, if you do it. And the IRS, they publish a rate that you're allowed to get. Right now, it's 56.5 cents. That includes your car, everything. Not only this $133,000 we pay you all on this auto allowance, we take out Medicare and Social Security. So it's actually just pay, extra pay. You're not supposed to get reimbursed going to and from work. And I just think that the reason we got such a differential in our low-paid people and our high-paid is our high-paid people are getting too much. You just happen to be one of them. I feel the same way about the commissioners, but that's...
Sir, I wish you all on the correct amount on that I receive. I don't receive $65,000 a year.
Well, this says this, and then plus we pay taxes on it. We match it, 8%, Social Security and Medicare. You get $40,000 from the county on this. You get $8,760 for something over here, and then you get $15,600 that we pay you. That adds up to $65,122.
Another thing I'd like to say is my gas bill runs me around $700 to $900 a month out of that car allowance. And then I got to do a car payment and insurance.
I'm just saying that we count it as payroll. It's showed in the budget as payroll. It shows auto allowance, but it's payroll. I don't think it's right. And I think that we need to not have it. And I don't believe it. It's just a way of extra pay, and then we pay taxes on it.
Carl, why did we have to start doing it that way? Was because of the...
Well, there's 2 ways you can do it. You can pull out part of it and say it's going to be a car allowance, and you're going to need to provide your own car, pay your own gas, set that under whatever you want. But if you do it that way, you pay the same flat amount every month, but you have to go to the payroll, that's how they require. You have to pay payroll taxes, you have to pay income tax on that money. We do not run it through retirement.
That's what I thought.
It does go through Social Security, Medicare, and income tax. The other way you can do it is you can say, we're not going to give you a call allowance. We're just going to tell you to keep track of your miles, turn them in, and we're going to reimburse you 56 and 90 cents a mile. You have the option to do it either way. You do the reimbursement, it doesn't go through payroll at all, it's strictly a reimbursement. But you have the option to do it either way. The amount that we've said is the car allowance, you can argue it's too high, or you can argue it's too low, or you can argue it's just part of their total package. You know, the commissioners make roughly $69,000 a year. That includes their car allowance. You can say it's $50,000 for payroll and $15,600 for car allowance, or you can say, look, we'll flip-flop them around. We'll say $55,000 of it's payroll and $14,000 of it's car. I mean, you can use the numbers any way you want to use it. The bottom line is the county pays them $70,000 a year for their job. They pay all whatever they pay her for her job, and she has to provide her own car. They have to provide their own car. It's part of the package. You can argue either way you want to. You can say it's too high. You certainly have the right to say that. Some people say it's too low. Some people say it's just right. But that is a fact. They do make X amount of dollars, and it includes so much for salary and so much for car.
When I say that pay, average pay of a county employee, I'm not including any of that $133,000. That's, no, I'm not. No, I'm not. All right, well, I'll show it to you. That was the Titus County retirement thing, our Texas retirement we get. She's got her number of employees, the number of employees on retirement. I don't have it right here. I think I've got it though, but it shows you how much the average pay of each county employee that's involved in the retirement plan. It showed for 2012, $34,400 and something dollars. For payroll. They said payroll. Well, this. No, it's not included. Oh, on the county employees, or no? I'll tell you where they got it. The 7% that we take out of the employee's check is where they got it. Do you take 7% out of that travel allowance? Well, so this is that, so it don't apply. And it's $35,612 is the average, or the pay after the $1,200 increase.
Well, if you back off everybody's travel allowance, you're not an employee that makes over 60, probably over 57, 58. So if you've got 12 elected officials that are making, well, all of them make that. What's your salary without the travel?
It's
What's your travel without the travel? I mean, what's your salary without the travel? It's less than 50.
$44,306.
Okay, so
Here it is.
I mean, if you take all those elected officials and you don't include the travel, then I don't have to be sure about that.
Well, you'd increase the expenses by $133,000. Then you add back, like I put on my budget for 6,000 miles, $500 a month for times 12. And you can put down the mileage you want to and see how much you'd have to drive. You'd have to drive more hours in a day than to get to 15,600.
You'd have to drive 7,000 miles a year.
Yeah, so how long would it take? You got 100 miles of road, so you can drive every road all day. Almost. It would be it's unreasonable to think that we drive that many miles. That's
part of our job.
Ms. Scarborough is patiently waiting here to say something. I'm going to recognize her.
It's not only the gas that you buy, but you've got to buy insurance on your car, your wear and tear on your car, up and down these roads. The car depreciates every few years, you go buy another car. So you've got to figure that into your expenses, not just gasoline. And what I think was their stop as a county commissioner, and we have very good commissioners, and they're worth every dime we make.
The IRS figures cost of a car, cost of gasoline, and they adjust those rates when the gasoline goes high, 56.5 cents. It can change. If gasoline goes up another $1, they'll increase it. Insurance goes up, the price of automobiles, through the years it's gone up. They're always adjusting that. But that's what it includes. It's not just for fuel.
Does that cost 50-something cents? I mean, I don't think that includes the car payment, the insurance.
Yeah, 56.5 cents a mile. The IRS includes that.
That's including car payment, insurance, mileage.
You get 50.
That's what the IRS says is an appropriate amount to reimburse someone who is using their personal car on a per-mile basis. So that has to include everything. Depreciation on the car, gas, oil, repairs. Okay. Anybody else want to discuss this? Yes, ma'am?
I know that some of the departments have asked for a raise, and I know that not all of us have asked for a raise when we were in our budget meetings, but it's my opinion.
Can everybody hear? Okay. Hey, there's a mic right there.
Right in front of you.
Do you want me to start over? I know that some departments ask for a raise in the budget hearings, and then there's some of us that didn't ask for raises for our offices. My opinion is if the county gives any certain department a raise, they need to give all county people a raise. And I just wanted to make that clear, that just because some people asked for it and some people didn't, if a raise is issued to one county employee, it should be issued to all county employees at the same pay, or the same rate.
Okay, thank you, Diane. All right, yeah, we did include the discussion about auto allowance, and I won't necessarily cut that off, but going back to raises in general, was there anybody that had anything specific to say? Okay. Anybody wanted to say anything specific about auto allowance? Okay. Judge?
I would like to say I appreciate my car allowance. We do use it. We go out all during the night for mental commitments or inquests. And you don't think about that much. It's your family members that were called out on. And we may go out several times during the night. My plan, if mine is done away with, then I'm going to have to call a deputy to come get me. But I appreciate what I didn't have.
I think the point Commissioner Riddle was making was, rather than, he supports a per mile, keep track of your mileage as opposed to a fixed dollar amount.
Okay, I go out 2 or 3 times during the night. I'm pretty sure I'm not going to go home and write down how many miles I went. I'm pretty sure I'm not going to do that.
Definitely an argument for the simplicity of a fixed amount, yes. Okay.
The JPs get $50 each time they go out to the hospital or pronounce somebody dead.
No.
Why do they get $50?
Well, you said two things, not when they pronounce somebody dead.
Whenever they go out.
Mental commitment.
We do, but I also did one the other day for Franklin County because they would call me, but had the courtesy, go ahead and do it for Franklin County, which they didn't charge us and I didn't charge the county. So there's hard times that we do things like that. And that's a job we don't have to do. We can give that up. And the county judge will have that responsibility. So
But not on inquests. There's no additional money paid there. That's part of your car allowance.
maybe, most of the time you don't have 2 or 3 days tonight, but it's always possible.
It's always on the expenses between Kay and Paula. $300 or $400 every 2 weeks. They get paid extra, and I thought that's what it was for. I don't know what it's for. But if they got to fill out papers when you go out, I don't see where it's a problem to put down your mileage. I mean, I don't understand why
If you go out there and stay at the hospital with a mental patient about 3 hours, I'll call you and you go with me, and we'll see how you are going to stop. Well, wait, let me write my mileage down. While I've been dealing with a family that's just committed somebody or just trying to kill themselves, then I'm going to stop and write that down. I don't think so.
Judge?
I did some figuring on over the weekend about our pay and stuff like that. If we get paid a salary, all right, we'll get paid a travel allowance. Then we get in addition to that, we get paid $50 per time for doing work, protecting custody for them. Now, the first thing is we do those for the county judge. He gets paid to do those. That's part of his salary and his statutory duties. However, it's a little more efficient for the people involved, or everybody that has to be involved in the process, for us to do it because we were on call. So, a long time ago, it was decided that when we do those, we turn in a $50 deal because it's not our job. That's number one. So this year, I think it was 12,000. $12,600 as of the other day for us JPs in K doing Judge Lee's OBCs. So that's one way to do it.
That was the total for the both of you combined.
I've done 130 so far this year. Kay's done 115 for Judge Lee.
How has that number over 10 years gone? I'm just curious. Is that going up every year?
Over 10 years because we have solutions in the county streets and nothing. We didn't used to do it. We used to just do it on sterile patients or to private patients, private hospitals and around the area. We have that here now where they're coming in here. And that's why if you pay us $50 to do it, because we're on call. So when we get down to how we're on call and how we get paid, you seem to have a problem with how much money we get paid. Our salary, JP salary is $44,206 a year. We get $7,200 in travel allowance or auto allowance. We get a cell phone allowance. We're on call. Okay? If you count the number of hours that we put in without the travel allowance, we actually, I got the formula here, I'll give it to you, out here. Terry and I actually make 19 Friday because we're on call every other week, 24/7, 7 days a week. So if you put all those hours together on our on-call week, it comes up to 4,368 hours a year. When we're not on call, we put in a regular 40-hour work week. That's 1,040 hours per year. That all together, we put in 5,408 hours on call regular time together. So if you figure all that up, if you add the travel allowance in, we actually make $9.52 an hour. No one can ever pay us any overtime for that. We're similar to, like, I don't know, firemen, policemen. When we're on call, we gotta be ready to go. They call us, we come out, we go to the same place that firemen and policemen do, because we do inquests. We pronounce people dead. We do the paperwork for that. We certify that. We send people for autopsy. So, what she just said earlier, I've had it where I've gone out 4 times in the night. By the time I get back to bed, I have to swap out every week. When we're on call, we put in that number of hours. Nobody's ever paid us any overtime, ever. We've never asked for it. We have a salary, we're just here. It affects our lives. We can't go anywhere when we're on call. Because we have to be here, because it's only me. When I'm on call, I don't get paid. When she's on call, that's it. You can't do it, you can't do it. Nobody else in this room can do it, it's just us. That's why we put in those hours, we have to be here. All right? Again, you don't pay us overtime. We do things because somebody has to be, there has to be a magistrate. We do things for the district judge. We do things for the county judge. We're on call. So when you break it down, we're making about $8 an hour. And you're worried about, we're making too much. So, an alternative to that is to hire an associate judge or a former JP to fill in for us so that we don't have to call with all those hours in. If you do that, you probably don't want to. You can pay us overtime, we'd take it. They might have ever really overtime for JPs. That's perfect.
All of
I
it.
should have said it.
I want to tell you, I appreciate the job, Lord, they all do a good job, I appreciate it.
I didn't say that. I just said the $7,200 a month extra pay. I was only pointing that out. I don't know what the job should pay or anything, but I'm saying that to add $7,200 and not show it up as salary is not right. I don't agree with that. And it should be, you should fill out a mileage or expense report for the miles you drive. That's all.
Well, again, we're criticizing things that were done. These were decisions that were made years ago. And I don't know that we should hold them responsible for something that was, for a decision that was made years ago. I wasn't here when that decision was made. I wasn't in the audience to say, yeah, I approve that or I don't approve that. So I think it's a bit unfair to, to them specifically to say, the way that it's accounted for is not right. I don't know where the people were when these decisions were made. My guess is it was probably an empty room back at that time. But I understand your point. I think I do. But you're questioning these automobile allowances and whether they could be handled on a per mile basis or on a flat fee basis. Again, that's a decision that was made years ago. Have you all ever been on a per mile claim format? Well, and again, I wasn't in the audience when these travel allowances were approved. I'm sure that there was discussion at that time, and how they arrived at them, I don't know all the steps that they went through to arrive at that. But, at this point, I think like Carl said, it's a part of a total compensation package. Do you have a large auto allowance or a large salary, or a combination of the two is what we have.
My point is, this is how much money that salaries we're getting. When you add that to it, it's put in there and the taxes are paid, so it's a salary.
Absolutely.
They still put in,
absolutely.
And that's the whole point that I'm trying to make. How much an hour or what it's worth, I'm not arguing those. I don't know that.
It is payroll, and it does have payroll taxes taken out of it. That is correct. The only difference with auto allowance is it is not included in the calculation for retirement. Okay. Anybody else that wants to talk specifically about this subject, auto allowance? Thank you for your comments out there. Go ahead.
I should make another point. I really think, talking about salaries, I think that the sheriff supervises 60 people, roughly. That's 1/2 of the county employees. He's the most susceptible to lawsuits. He has the most danger. His employees put their lives on the line daily. And I think that he should get I'd like to see his car, that 15.6 that he gets, be done away with, and him have a car and add 15.6 to his salary and pay him that kind of salary, because he's on call really 24 hours a day, all night, every day, 7 days a week when things happen. And so I really think that's one exception to the pay. I think his pay should be greater than most of us in this county, and he's not. And I'd like to see that his car allowance put over there and his car allowance taken away. That would be, I think, the right thing to do in his case.
When you do that, you're going to have to furnish him a car then.
That's right. He needs a car.
You're going to have to buy a $35,000 car every
That's
2
right.
years or whatever.
I don't see anything wrong with that.
Well, here's some information, this we're talking about salaries, dollar allowance and stuff. Elected officials, Mike gave me this says what everybody makes, including the travel, the elected officials. County judge makes $87,000 a year, that includes his travel, it's all related to compensation. County attorney makes $86,000 a year. Sheriff makes $77,600 a year. Commissioners make $70,800 a year. The county constables make $56,000 a year. Tax assessor collector makes $53,000 a year. The 2 JPs make $51,500 a year, not counting the $50 fee, which is about $6,000. So they add that in, they make probably $7,000 a year. The district clerk makes $47,760. The county clerk makes $47,760. And the county treasurer makes $47,760.
And this is public, is this published each year? No?
It's just public information that's in the only thing that's ever published is if you give them a raise, and that's published.
Okay.
The amount of raise is published at the time of the budget. I think what Paul is saying, and I think probably most of these people will feel the same way, and I've talked to you before, you feel the same way. Whether you call it travel allowance, whether you call it salary, they consider the whole thing their package. This is how much money they're getting, they have to buy their own car and their own gas. That's the way they look at it. I'm wrong, that's the way they look at it. And when you take all that into account, the hours she works, Paul was telling you that even with all the travel allowance, she's making $9 an hour. That's what she's telling us.
So while you're working, you should give me a raise.
I'll recognize you.
I would just like to begin, Jacqueline, you get called back in when they're not on call. They don't get paid call time to come back in whenever we have to send somebody to the hospital at 3 o'clock in the morning. You also get looking at it, also they're not put on call, they're just called to say, hey, can you come help us out? And they come in and do that. And these are people who make $11 to $12 an hour. So that's just something.
Thank you. That's right. That's right.
That's why I suggest to do a pay raise, to do it like we did last year, if we get one, where it actually helps the lower paid people, because that's who need to go. They feel a little bit, they get 2%,
Yeah.
5%, doing it that way.
Well, that eliminates the higher paid continuing to get higher and higher, and the lower paid continuing to get lower and lower raises.
That's my raise as far as percentage, but it doesn't, the lower paid raise. They got about 3.5% slot.
Right.
Last year, that $1,200 amounted to $20,000 people made 6% increase, and the $50,000 people made 2%. That's why it was a lot more fair. And through the years, I'm sure this is how this big disparity between the low-paid people is. Everybody got 2% or 3%. So the distance grew between the low-paid people and the high-paid.
For years I've been here, we've alternated it both ways. Some years we've done a flat amount, some years we've done a percentage, but we tried to even it out. But if you're only giving a 2 or 3% raise in the years with inflation of 2 or 3%, then no matter what they were making, we were just trying to keep everybody with the same spending amount of money. So, I don't think doing it one way or the other all the time is fair to either side. So we're trying to automate some. Whenever we do flat rates, whenever we do percentage, whenever back and forth.
Just give me the facts. I don't know
I
what
tell you
you...
what the city did when they were in the cities, they actually, like, you had, someone was making over the 40 or more, they got like 2%, and then anybody under that got like 5%. So the people that say that.
Okay. All right, anybody else? Thank you, everyone, for everything that you pitched in. Barbara?
This is the third budget we're not into, and I guess my question, I haven't heard anything said along the way. Is there a budget shortfall this year, or taxes going to go up? Is there money to give raises and do all those things that everybody wants? I haven't heard anything on this yet.
Yeah, fair question.
I've got the figures that were kind of, suggested that the effective rate that we can go to, because our valuations overall went down, because the Texas utilities, aluminum, whatever you call it now, we can go to, I believe it's 43.34.
We're right at 40. We're right at 40. 39.99 right now.
So you could go to 43.34 cents and not have to hold any kind of hearings, because all you're doing is collecting the same amount of money that you collected the year before. You had to have a higher rate because the valuations went down. So when you multiply them out, in order to get the same amount of money that you got the year before, you have to charge a higher rate on the valuation
But
rate.
if the price value goes up, then you're still stuck with that higher rate, right?
Well, you can change it from year to year, yes, but in that particular year, you're allowed to keep the same amount of money. I don't think, from my conversations with members of the court, that anybody wants to go. We are going to have to go up a penny on the INS rate, because the amount of money we have to make the bond payment they lose is a fixed amount. It's 3.1 million, and you get, if your valuations go down, you have to go on the rate, collect the 3.1 million. So I think that rate's going to go up a penny.
That's not a choice we make.
That's not a choice anybody has, that you have to do that, you have to make the bond payments, and it's going to be 3.1 million.
That was a planned increase based on the way that the loop funding was laid out years ago.
The question's going to be whether they want to raise the maintenance and operations rate any. If you go up a penny, we're going to go to, and I think just barely over a penny. I think the INS rate is going to go from 13.05 to 14.08. It's a little over a penny. That's going to bring your rate right up to 41 cents. Roughly, right at 41 cents if you don't do anything with the maintenance and operations rate. Because of the savings we've had in the insurance fund this year, I don't think we're going to have to make an extra $125,000 contribution as long as we have to make to that. So we've got some money we can save there. Let me go back. If you don't raise the maintenance and operations rate at all, because of the lower valuations, we're going to be $400,000 less money maintenance and operations budget than we were last year. So if we want to leave the rate the same, we have to find $400,000 somewhere the same. We can save $125,000 of it with not having to put extra money in the insurance fund. The sales tax from the 2 years ago, it was really hard times. It's up about $250,000, maybe $300,000. So I think you can leave the rate the same and maintain your same number. We also we are fortunate, we do have a $6 to $6.5 million fund balance reserve in the general fund. We're holding on to that because of the loop project. Until it's totally finished, we know what our final cost is. But we do have reserves there that we can get into if we need to. If we did run $100,000 short, I'm not concerned about having to take $100,000 out of a $6.5 million fund balance. We can do that. So I think we can maintain the same rate not have to do much in the bottom. The question is, you want to give some raises to the employees, and you've got two ways to do it. Either we're going to have to go up a penny to cover those raises. That's still going to be under the effective rate. We're going to make the rate 42 cents instead of 41 cents. That's still under the 43 cent rollback in the effective rate. The other way is you can say, well, this one time, we'll pay those raises out of our fund balance. That's not something long-term you want to do. Basically, you're dipping into your savings, pay your operating expenses. And at some point, that's just not good fundamental financing. You don't want to have to use your savings to pay your operating expenses long-term. But, like I said, with a $6 million fund balance, we could probably afford to do that at once. I don't know how the court feels about that. Those are the options you've got if they want to give a raise to the employees. Because once you give a raise, that raise is from now on. Nobody's going to want to go back and shut people's face. I'm saying you can, but nobody wants to go back and cut it back to pay. So once you get those raises, you're going to have those raises now on, and you're going to have to give your fund those raises.
Well, if you take it out of fund balance this year, next year, unless you do it again out of fund balance, you've got to somehow make it up out of next year's tax revenues. That's why I don't think I'm going to support that.
I wouldn't support it either, not this year, not today.
I'm not saying I wouldn't support raises, I'm saying I don't support taking it out of fund balance.
Two options you have is either use some of your fund balance to fund them, or
I'd like to get this loop project completed before we go and start taking away that fund balance. At that time, I'm going to feel a whole lot more free to reduce that fund balance down to a lower level.
Judge, how long are we going to be responsible for the bonds that we're going to do?
we're responsible for our part of the bonds until they're finished with 20 years. Our part of the bonds, according to the cash flow statements that the judge and I have looked at, goes down to about $2.5 million a year in 2 years. Right now, we're paying 2.8, so we go down about $300,000. Now, the 2004 bond, what I call the Art Club Chapel Hill bond, it is paid off in 2019, I believe. So we've got 5 years on it, it's about $300,000 a year. The other part, the state's going to pay $8 million a year, so most of that goes to making the principal payment on the project. We have to always pay about $2.5 million a year until the bond is paid off.
The major, go ahead.
I was just gonna say the INS tax, as our debts decrease, that goes down also by law.
Maybe a little bit towards the end, but he had, but we, from the beginning, we figured that rate was gonna be about 13 cents. So, and that was not counting any decrease in valuations.
Yeah, but when they're eliminated, that's INS would go down to whatever debt we got.
It's this year's gonna be 4.
Once the loop is completed, Sheriff, and you may already know this, but when the loop is completed, 6 months after that, the state of Texas will begin reimbursing the county for the cost of that loop project. Now, that doesn't mean that all of a sudden we're going to have a lot of money coming in that we can use to reduce taxes. All that is factored in. It's a 25-year plan from the time that loop construction was begun until the time those bonds are paid off. And the county basically is paying the carrying cost in the way of interest payments on that loop project because the state's not reimbursing us for what it cost us to borrow that money. They're paying us back for the cost of the loop. So we do have some money that will begin flowing in 2015, but nonetheless, the county, through that bond election years ago, committed to allow the Titus County to raise the rate or the tax rate to encompass that debt service and the cost of that loop.
Right, and that was my question, because how did the bond, like 25-year bond?
20 year.
It's gonna be 2.5
But we don't have to wait another 20 years to start raising some savings. I mean, 5 years, the county can relieve us of that debt.
Well, beginning in 2015. If we finish that project in mid-14, by the first part of 2015, that money starts coming back in from the state.
They start paying us 6 months after the project is
About $8 million a year.
Is it 6, 8?
It's $8 million a year, it's every 6 months, and I think we were the only county that got the 6 month bill. Everybody else, it's a year. They get paid once a year, we get paid twice a year.
We get paid $4 million every 6 months.
4 million every 6 months.
And if our count, or the count on the road goes higher than what they projected, we could get more than that. We're guaranteed $4 million a year every 6 months.
And that interest rate is fixed, and that interest rate is low. And it's lower than was expected, primarily because of the size of that fund balance that we had. Had we been using our fund balance or had not set aside money to have a good, solid $5 million plus fund balance, we would have paid an additional, what, 0.75%?
It was more, so we saved $900,000.
No, over the life of the deal, $9 million. Yes.
Over the life of the whole bond, it
The
was,
whole bond.
yeah, it was several million.
It was a lot of money we saved because we were
Financially
very sound financially, and we had reserves, and we had a commissioner court that's been here for a long time, we have a county auditor that's been here 20 years, and we have a real responsibility of development. It saved the taxpayers a lot of money. I thought it was nice.
I don't remember the figures.
It's $9 million.
Judge Dyke.
I've got it.
I just want to say, we appreciate you, all of you. We understand that we're in hard economic times. You're looking at things that happen, you know, over the years, long-term plans, stuff like that. We don't deal with that. But it gets down to, what I think what we're trying to tell you is, when it gets down to it.
Go ahead and say it.
What's down to it? Okay. Raise versus benefits, do not jack with our benefits, please. If it gets down to that, please consider that our benefits are important to us. If you're talking about figuring the tax rate, this and that, blah, 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 get the fund balance to get a raise, save our insurance, save our benefits before you do that. I think that's what we're trying to do.
Yes, I think most employees were going to go out raising your use benefits and have a raise and have to back off of that.
Thank you.
Y'all did such a good job, and things are going to get better. You just told us they were, after so many years, and, you know, the state's going to take it back. Have your time, we'll get a raise, but don't jack with our benefits.
Well, and the one thing in all this that kind of disappointed me was to hear several comments about how bad our health insurance is. That's news to me. And the only ones that have come to me and seen me face to face or sent me something in writing that we have addressed, it is my understanding that each one of those, either by change that occurred as a vote from this Commissioners Court, or simply notifying a local doctor, or simply educating that employee, I believe that we got whatever that complaint was exactly on par with where we were with Health First. Now, I know that East Texas Medical Center, that was a significant change in this. We felt like it was offset by the additional benefits. But in summary, I would again say, if you feel like there is some place in your health insurance reimbursement that doesn't look right, or you do not think it's fair, please, please come to me, or please call Tony Melton so that we can figure out why. And we have made 2 changes to the plan. The Commissioners Court said we are going to change that plan here in mid-year so that this doesn't happen anymore.
We're so used to it being going well, that a lot of us don't know how home insurance stuff works. I mean, this is new to us too.
It's complicated. It's complicated, and I am confident we have the best people that we could possibly have that are advising us on this. But again, they're going to show us any number of options, and it's up to this court to make those final decisions. So don't get down on CAPS Insurance or UMR. They do what we tell them to do. But you all tell us, hey, here's a situation where it's broke, it ain't working, it's not fair, and all we can say is, well, I'm sorry, that was a concession that we made when we changed to save some money, or we're going to say, well, we'll take a look at this, and we don't want this to happen to you. We're going to make a change to this plan to be sure it doesn't happen again, or we're going to pick up the phone and we're going to call that doctor and say, hey, please do the lab work here in your office, please don't send them to the hospital, because based on the way our plan works, it ends up costing that employee more money. And we don't want that to happen. Okay?
So are you saying complain to you, complain to CAP?
Well, I can guarantee you that I'm not going to be able to answer your question, but I can guarantee you that I'll contact CAP. So if you want the absolute quickest route, you'll call Tony Melton, or you'll ask me what her email address is, and that's the absolute best. If you can have a documented conversation going through email where they're responding to you, and she copies me on every single one of those emails. I'm always in the loop on an employee situation. That doesn't mean I know specific medical details that I shouldn't know, but I understand and I know what the general topic of discussion is. And I can keep these guys informed about it.
Well, I've called CAP several times, and, they're like, well, there's nobody here. Oh, you work out of county, so what? I called them tomorrow. I asked them, I told them some stuff on my internet, they're calling them, well, I can't get the government pay. I talked to them on the phone. I was doing it on the iPad. I couldn't turn it off. I said, can you fax that to me? They said, oh, no, we have to charge $200 to fax that to me. I said, excuse me, it's my record. Well, if we fax something, it's going to cost you. Hey, it's my record. I mean, that's kind of problem we have.
Shoot me an email. I'll get you Tony's direct email. And again,
They tell me the problem's solved, turn back around and call the person, the place that I don't want to tell you what I call, because it's personal, but anyway. And they're like, no, we already tried that, it's not going to work, they're not going to pay, I'm just telling you. And that was back at the first of the year, we were saying that, it's, I haven't paid for the doctor, it's like, oh my God.
have you had any conversation about this with anybody at CAPS Insurance?
No, it's here right now, I'll call you back.
Yes or no? Okay.
Shouldn't have to call CAPS Insurance. I mean, there's people here, and I personally that have told me, I guarantee you that the sheriff's office alone, there's probably 50+ complaints. But we shouldn't have to worry.
Is that accurate, Sheriff? 50+ complaints?
I don't know about 50.
Have I responded to everyone you've made me aware of?
That, yeah, that makes sense. Ken was, his is the one that I kind of helped with and got involved with, because it seemed like, John, I don't know if John's had a chance to, because his bills just come in, he's got a complaint that they're doing it the same way. Have you talked to Cap yet?
Ever since time I go to the doctor, my family goes to the doctor, all I get is denials. If that's what you want from your insurance company, we're right where we need to be.
But I mean, have you talked to Cap about that yet?
Now I gotta go down there and probably send stuff like that.
We do need to know that Cap.
Yeah, every single time I have to call them, every single thing to do. I don't know like that.
Well, I'd like to know what's causing this, so that when we sit down and negotiate with CAPS and with UMR, we can say, we want to eliminate this kind of headache. Okay.
That's the big thing about this insurance.
Okay. Okay. You have to say?
Maybe the way we're down, they're not paying.
Well, tell you what, we're going to take a 10-minute break. I don't think we have a whole lot of more topics to come back up with. I know some of you probably need to use the restroom, so let's take 10 minutes. If you still want to come back, please do. Thank you, Clevie.
Run before you get line.
We've hit all the biggies.
They'd hold out to the time then, but that'd be the only difference in the whole thing. I mean, he don't understand all that stuff. Say, what are you thinking me for? What are you thinking me for? Well, they're talking about the JP's talking about being on call. I got a call Friday night at 10 o'clock. And then the thing is, he's sitting down there. I had 7 people. One of them come to me and asked me, said, why don't you do me a favor and tell him if he'd drive his roads, he'd have more than $400 or $500 in travel. They said, we never seen that here. They had a road. Principal over King High in Texas. He hit one of the bumps that they got out there and done something to his car and had it fixed. You know, they told me, and I said, you don't get much. Right.
Oh, I got you. So maybe you can give me a raise this year, just get one next year.
I don't want to pay for the fact that I've sure enjoyed them for the other 20 years they've been here, but now that it's costing me more money, no, I don't want
But I appreciate you guys.
What are you talking about? Not right. What are you talking about?
a taxpayer that says Lumen has devalued you by X billion dollars. You all should cut your budget because I sure don't want to have to pay for any problems that have caused by that devaluation.
For so many years, and even though we get a resident, we're still low. If our taxes were high, if our taxes were our wages, but they're not, that's the vacation. Our taxes are not. I'll do that if you don't want to raise or do this year.
I think everybody's sitting up here except for maybe one
increase the fund balance to give.
I'm not gonna, I don't here. A lot of people tell me you're doing gas too. The same thing that you told me I wasn't driving no gas. Maybe so. Same son of the bitch you told you that. I ain't stolen that gas. Some bitch you told me that was a goddamn lie too. I heard you say you were a bully. I'm not driving a bully.
Oh, this hasn't been too bad. I mean, it's good to have one of these.
Let me tell you what, it's good for the employees. And irregardless of what comes out of this meeting, one way or the other, your elected officials, lowest employee, paid employee.
Nobody got hurt. Nobody got hurt. Well, I ain't over yet. No, it's too much. Too much. I can assure. Too much. I can assure you. Hey, when do y'all go to school, Paul? When do y'all go to school?
This is go Friday. It's just for a 3.5, 4 hour school up and down. You'll go.
What's it about?
It's legal updates. It's one that particular mandates that you take every 2 years. It comes out of the latest changes in legislature and court cases, and it's put on by the.
Why ain't John Martin?
He'll probably go to the one in Corpus Christi in and get it in. I mean, that's a class that they put on there for all. We just try to go to it. There's some place that's close enough, it doesn't cost us an overnight stay. Just go to and that's why.
He'll be in there covered for all y'all on Friday.
Let me tell you.
And I'm gonna tell you what everybody's telling me. You ain't never told nothing in years.
You're installing gas, I paid that.
I ain't never told
It's probably doable on Friday.
The ones that do it.
Well, they not gonna talk to me anyway. Thank you. Thank you. Thank y'all for being here.
I appreciate you guys doing that $100 raise. That's a good thing. You're a good guy. I fully support you on that.
I have very little left.
I don't have anything. Put the fingers together.
Some ideas from y'all what to do.
So I'd like to see it later.
Hey, Mac, my point is, I mean, I'd love to have a raise, but if you can't give us one, I don't think you get any. I mean, but
I'd like Carl to crunch the numbers, get them all put together.
I can't go through all this. I mean, I tell you, it's me.
To do a raise. To do a comparable raise to what we do.
What kind of rate are we looking
I'd like to do $100, 50 to 100.
$1,200 a year. We did something less.
To do that would cost a penny.
Cost a penny. You got nothing.
Now, I'm leaving now, don't you? I don't have
We ain't got nothing, Jeff.
Well, I wanted to ask you about a CASA increase. They made a request for an increase from 20 CASA, 2,500 up to 3,000. And then,
I gotta get your own
would we be willing to ask for
Wasting steam, but that's okay with me. Afraid we're gonna let out.
would we be willing to request AGM?
So, about stuff. Pretty complicated. I don't want anybody to.
Would it put some folks to rest? Laney's going to be here Monday night. They get that time.
Well, they tell me I can't have one, but I can't do anything with these expenses.
Yeah, you can have a fun time. Who's say we can't?
People that don't know it's I have some things to say.
Okay. Let's get it. We're about ready. Oh, yeah.
Oh, yeah.
Did they give us back our?
No, this is a front.
On my list here, I think we've hit everything that I wanted to discuss. I have one minor item here. CASA, Court-Appointed Special Advocates, as you know, is no longer going to be associated with the CASA based out of Sulphur Springs. There is going on right now is the preparation for another CASA that would be based out of Mount Pleasant or based out of Titus County and would include Morris and Camp counties. So this is a startup venture. They have made a request to us to consider an increase in our monthly commitment from $2,500 a month to $3,000 a month.
Judge, have the other counties, we talked to them about also helping?
I do not know. We're not having anything to do with that. CASA's handling that.
Okay.
So, and our $3,000 a month is not going to fund that whole department, so they're going to have to be somewhat dependent upon Morris and Camp if those two counties choose to participate in this. I think that there's some pressure in Camp County from the attorney's to not be as supportive of CASA because the attorneys want to continue to serve in those roles rather than a CASA volunteer. So I don't know what the outcome is going to be there. I have not gotten an update on that. I'm not on that steering committee. So that's one consideration.
I'd just soon leave ours at 2,500 till we find out what the rest of the county's gonna do.
Okay. And I'll see if I can find out some more information there.
Well, I know CASA's a good program, and I know it helps the kids, so Deborah has some.
Okay.
Because I know we don't use the cost out of Silver Springs. And, on our jury form, the donation, there's that option to donate to CASA. And we just taken it off because of since we didn't have Silver Springs anymore, we wasn't sure if they had gotten one together here. Do we need to put that back on the jury as an option?
Well, again, as of right now, we are still associated with Sulphur Springs, and I think they've postponed the cutoff date to the 1st of October or,
September 1.
well, I thought that was the original one, was August 31st.
Okay, maybe
But if it's been moved, it's only been like by a month or two, just to give them a little more time to get formed. So,
Can you tell us how much that might bring in a year? Average, just average.
I'm assuming that they're figuring that continuing, and instead of going from, going to the Sulphur Springs operation, it would come here. But again, I don't know that. I've not been involved in that.
I think they need to come to court and request that. That's the way CASA did over there. They came and requested it.
Until they're set up,
Okay.
unless you want to continue to fund Sulphur Springs.
Well, why don't I just maybe ask them to come and give an update to the Commissioners Court as to what their status is? Either ask Michelle or one of their board members or steering committee members.
I think that'd be best.
That's good, Judge.
Thank you, Deborah.
Okay, that was the last item that I had here. Well, let's see. I did get a call from Judge Woodson the other day, and the topic of discussion was fund balance carryovers in the road and bridge funds. And the request that he was discussing with me was whether or not we would be, or would Carl be willing to submit a request an attorney general's opinion. This coming Monday night, I've asked Lanny Walker with Arnold Walker and Arnold to come and discuss this issue with us. Tell us how this is handled in other counties. Tell us what the pros and cons are of having fund balance carryovers. Tell us what he sees in the other counties that he audits. I'd like to listen to that before we do anything else, but
I know counties and school districts and cities, everybody's allowed to have fund balances, so whether you want to leave them in the different funds that they're in, we have a lot of funds that have fund balances, whether it's law library fund or whatever, there's separate funds in their categories, separate funds in the books of the county. Whether you want to take the extra money that's in the four road bridge funds and roll it back into the general county's fund balance,
Who's?
the option that you have, and then whatever equipment needs to be bought, they have to come to the general county. But no matter which way it's done, and I think there was some confusion on this earlier, you have to have a budget, because you have to have it approved by the court before you can spend any of the fund balance, whether it's general county's fund balance. And those budget amendments that I give y'all, whenever they're done, that's what the law is. Those are budget amendments to spend the money that's in the fund balance that hasn't already been budgeted. And then a perfect example is going to be if we proceed and do all the remodeling over here, it costs $600,000. If we don't know that number at September 30th, then when we do know that number, we'll make a budget amendment and take it out of the fund balance. If December, we know that number. We'll have a fund balance and budget to spend whatever money we're going to spend at that time. It's always accounted for. It's just not necessarily budgeted until you're ready to spend it, so you can put all the money back in the general fund if you want to, and we can change the procedures, tell each of the commissioners, look, when you get ready to buy equipment, we can set some money aside inside the general fund, we can even set up an equipment fund, and have a separate fund that's just for equipment replacement. But regardless of how you handle it, which fund you put it in, you can't spend the money until it's approved in court. It has to be approved, it has to be budgeted, and then the actual expenditure has to be signed off on by the three to go on the bills. So it's covered one way or the other.
Well, I don't want to make anybody think that I think I know all about fund balances as it relates to road and bridge funds. I don't want to do anything that's going to be restrictive or unreasonable. Anything that I do, I want to be sure that we are encouraging efficiency and prudence with our money. That's what I want to encourage. And to have the ability to allow fund balances in road and bridge funds to go to any level, to me, just inherently seems inefficient. As long as you know that you've got that pile of money there, it just doesn't seem to me like you'd be making the efficient decisions and really pushing yourself to stretch each dollar as far as you can. I would be in favor of maybe something in between, maybe put a cap on what you could allow a road and bridge fund carryover to go to. Yes, yes. Yes, and encourage some long-term budgeting, 5-year budgeting, equipment budgeting of some sort where you anticipated these expenditures while still allowing a balance in your fund balance that would cover, unforeseen, expenses that came up.
Either way we're talking about is it's just managing the fund. It's not saying that you got to spend every dollar. But nobody does that. You don't spend. Everybody has fund balances. If they don't have fund balances, they're either like Upshur County where they're broke, or
I understand that everybody has fund balances, but if I equate this to my own personal finances, the more money that I have in savings, the less likely I am to really challenge each day-to-day expense that I have, because I know I've got a big bunch of money there that I can fall back on if I find that I've bought too expensive of a car, or I've built onto my house too much and I didn't plan for the additional insurance and the additional expenses of repairs and maintenance. I know I've got that big, huge savings account sitting over there.
The flip side of that, Judge, that I find too with state agencies that I've dealt with, where they don't spend all their money. The next year, the state will appropriate them as much money.
And we've all heard those stories where we got to spend that money so we can get it next year.
So, the flip side of that is, if you're going to tell somebody, there's no incentive for me to save up money, because you're going to take it, if I don't spend it, you're going to roll it back into the general fund anyway.
Well, that right there to me is a prime example of inefficiency of the system. I'm going to spend that money so I can get it next year. I don't know if I'll need it, but I sure want it.
But that's the flip side of what you're talking about. There's no incentive to, they're not saving any money, they're just sending it back. And like the sheriff
There's one thing you're leaving out. You set the tax rate a while ago based on your budget. Right. If you've got $600,000 sitting out there not on any budget anywhere until you spend it, your tax rate request is not valid. In other words, it's kind of got a hole in the thinking there.
I understand what you're saying. We can understand the same thing about the general. We've got 6.5. I'm probably going to finish the year with $6.5 million in the general county fund balance. You certainly can take that into account when you're trying to figure out the rates. The problem with it now, just strictly from a pure accounting theory standpoint, is the same thing that the judge was talking about, paying for the rates out of fund balance. if you say, look, we're just gonna lower the rates, and we use up all this fund balance, somewhere down the line, somebody's gonna have to, you're not gonna have that reserve anymore, and somebody's gonna have to raise the rates a whole bunch to cover the fact that you don't have 6 million to use to cover your operation. The way that I prefer to use the fund balance money is for special projects, not day-to-day operations. The remodeling of the courthouse over here, that's a perfect example of a good way to use your fund balance. You don't have to borrow money, you save it up, you'll pay cash for it, do the remodel. But that's a one-time charge. That's not like a pay raise that every year I'm gonna have to fund that. And when I run out of reserves, where am I gonna fund the thing? You can certainly make arguments both ways that, look, why are you raising my rate when you got $6 million in reserves? And people can make that argument. The other side is, well, we take that a little bit of time over a long time. We have a reason why we save it up. And we're not going to use tax money to pay for any kind of capital improvements or large equipment purchases or anything else for the next 20 years. And we'll use that fund balance, assuming we don't have to use any of the loop. Assuming it is still all there when the loop's finished, we'll have that money. And we could even, the last year, I know one day you asked if we could pay those bonds off early. We can't pay the bonds off early because the people that hold the bonds are entitled to get that interest every year. But we could, the last year or year and a half that those bonds are coming up, we've got $6 million in reserves. I could say, we're not going to charge any taxes. We're going to take this $6 million and make the last year or 2 years payments. So we're not going to charge the taxpayer any money at the end of those bonds. We're going to use that money. That's kind of what the water industry did. If you recall, they originally had tax rates out there when they built the lake. But they were able to collect enough money from Texas Utilities for operating money that they had the money available to pay those bonds for the next 20 years. So they did away with their tax rate because they were always going to have enough money to make those payments without having to charge the tax rate.
But that was just a one-year deal.
There are things you can do with it to where you do benefit the taxpayers.
Yeah, that's right.
But it's certainly an argument to be made either way. I just prefer not to use fund balances to fund recurring operating expenses because I think that's a poor financial plan.
Well, I agree with keeping the fund balance. I mean, no doubt about it. He even brought it up. That's the reason we got lower interest rates on the bonds because we had the fund balance. And I agree with all that. But it's no different. The same procedure, the commissioners have to vote to spend an emergency meeting and buy a grader if we need to, if something happens. And the same procedure goes through it. And yet the taxpayers know that you've got the budget out here and we're going to raise the budget. I'm just saying it's kind of wrong to me to have $600,000 not anywhere on the budget until you use it, and then you figure your tax rate based on that. And I know you don't.
I'm going to put a sheet in there starting this year. And I'm going to show you one of the copies because I got a copy of theirs. It shows all their fund balances. I'm not always see this. This was Hawkins County for last year. And on the front of the budget, you're going to have the budgets that's going to show the revenues and the expenses.
Right.
But it's also going to show the beginning fund balances.
Right.
And the expected ending fund balances if they run their budget numbers. And you can see how many funds they've got.
Oh, yeah. They
How
even,
many different ones have fund balances.
yeah, they have a,
But I'm going to put a sheet like that on the front of ours so that information will be available.
yeah, I made a copy of it. I made a copy of it.
No, on the budget report.
Here is that Hopkins County.
That's how.
Yeah.
Let me ask you this, what are you going to do?
So the budget that I put in the county clerk's office, they'll have that page on the front.
Right.
And anybody that wants one can have it.
And I've got a
Because it's
copy.
not in the budget, you're right, and there's nowhere to put it in the budget. But they need to know that, look, based on this budget, this is how much money you had in the bank to start the year. And if you hit the budget numbers, this is how much money we think you're going to have in the bank at the end of the year. Because basically, the fund balance is just cash. That's your cash. That's the money in the bank to start the year and the money in the bank at the end of the year. That's what the fund
The
balance is.
procedure to get it out is the same. The commissioner has to vote on it, same as get it out, so why not have it there? And,
Y'all want to roll it all back into, that's just a different way of
Well,
managing it. We can
Carl,
certainly
you know, in the past, what we've done, if we've come up, and I don't have the money for a piece of equipment that I need, and the piece of equipment I got's 20 years old, and the transmission and the motor blows, and what we've done in the past is come to the court and go to Garrity Bank, we borrow the money, and we make a monthly payment.
You won't have to do that if we've got fund balances. We've not had to do that in a long time, but we've had.
But how are we going to build it up?
That's the reason we have the fund balance. That's the reason we did started doing it back
Yeah.
15 years
But
ago.
what Alan, what the judge was saying is you could go to a system where instead of letting y'all carry all your money over in your own funds, we could say you can carry over $25,000 or $30,000.
Budget something.
And then the rest of the money, put it in an equipment fund or something, and then when you need a piece of equipment, no matter whether it's precinct 4, 1, 2, or 3, you're still gonna have to go through the court to approve spending the money, but it's gonna come out of a combined equipment fund balance instead of each one of your individual fund balance.
But I agree with the judge, having that over there is an inefficient way to do it. But they have Hopkins has a $210,000 equipment fund.
Do it, I didn't look see what funds they have on there, that may be the way they're doing it. The see, even their road and bridges have a little bit of money. I guess, are you talking about the big 500,000 piece out there?
No, it was 200-300.
See, there's one big road and bridge that's got $500,000. And the other ones have, $27,000, $28,000.
Well,
But anyway, it's there though. It's there, it's not.
If you have a major, say, we get the rain, they're getting in the northeast, and we get 25, 30 inches, and we have a bridge blow out, or 2 or 3 bridges.
Well, that's why I think they're saying, we're not gonna tell you you can't carry any fund balance, but we're gonna come up with a number that everybody's comfortable with. If it's $25,000, if it's $30,000, if it's $50,000, but anything above that, you put over in a combined equipment fund, and when any of you need equipment, you don't have to pay for it out of your fund, you pay for it out of that equipment fund. And we try to build it up over time.
Can I ask a question? How is the stockpile of money built up in each road and bridge fund? Is it just over budgeting every year so they can build up a little stockpile?
Well, we do it the same way we do the sheriff's department. We give them the same amount of money every year. If they, for some years back there, when Thomas built his up, he had one less road, he hired 2 people. Sometimes they made, in Don Bond's case, precinct 1, when I first came here, my Price was commissioner, it never had any money left at the end of the year.
And some of them had to borrow from the county.
But they were all getting the same amount of money. It's just the way they managed their money, and maybe possibly how well the roads were. Maybe some of them had to spend more money on their roads than others. But we've got like, the county's divided up into 4 precincts, taxpayers in all 4 precincts deserve the same amount of money in their road and bridge fund, 4 as they do with 1, so we try to give them the same amount of money in all the different funds. Sooner or later, the roads would have to be worked on, so, we try to equal it out the money that we gave. Don Boggs, when they were building the pipelines to his place, he went out and negotiated a settlement with the road damage. That's where all the extra money in Allison really came from. They can't fix, but probably 5 or 6 miles of road maybe a year. You always do that much.
Probably 10 if you could.
So, if they pay him for damage to 15 miles of road, the money's still there, but they can't do 15 miles of road. They don't have the personnel and equipment to do 15 miles of road. That's why Allison thought that he probably doesn't bring his company anybody. He's actually getting more money than his every year because he's not drawing off his salary. And so that money is in there too. But that position is still budgeted for the full commissioner's salary because I don't know legally how you do it any other way. If he goes out of office, whoever comes in his place is entitled to draw the salary. He just chooses not to draw the salary. Well, that means the other half of his money, if it's $30,000, how much it is going to be built up in his cash. And he'll have that money for roads, He'll have that money for equipment, he'll have that money for whatever else he wants to spend it on. If he wants to just give it back to the general county, that's fine with me, I'll put it in the general county.
The procedure,
But I didn't have it done so far, this is the first year we had. You know, that's how it's working. He's gonna end up with more money in 2 years than any of us, because he's not spending all his money.
Right, to me, I think as a taxpayer, it's odd, you know, there has been some money kept and all, you know, so it's big, and then you come to the taxpayers and say, we don't have enough money. Well, you do have enough money, stuck away in all these little different money. I'm not talking about the running of money.
Well, basically, we treat their money like their money.
Right.
Because they don't have to have a general county.
Right. Just make one big thing.
That's right.
For everybody.
That's right. That is an option that we could do. We could say we're gonna let them carry 25, 30, 50, whatever they're comfortable with. We're gonna carry that much cash this rainy day in your deal, for in case you do have bridges go out or whatever. But any monies above that, we'll just put it in the equipment fund for all the commissioners to buy their big pieces of equipment.
you're gonna have, that would create a emergency. What do you mean? He's getting a new motor grader and I don't have one. That's where you can go back there.
You can end up in that kind of.
Just put it in the general fund. And then when everybody, you gotta have a meeting and
You gotta prove it anyway, no matter what we do with it, even if it's your money.
right,
Two of these guys have to agree for you to spend that money.
I agree. That's a good system. And us having a big rainy day.
Okay.
Well, that's possible, that's possible.
Well, remember, Lanny will be here Monday night. Maybe we can save some of these questions and we can get, I think there's some members of the general public that would like to hear what Lanny has to say, and maybe it'll shed a different light on it once Lanny gives his input here. Okay, I've discussed everything that I had on my list here. I think Carl would like some guidance from us on several of these areas that we've talked about. We can run back over these if you would like. Anything you want to start with in particular? I was just going to start with how we discussed it today and maybe talk about health insurance and life insurance.
Well, I think the life insurance, you're gonna hold on to some talks too. She had 2 questions. She wanted to make sure the rate wasn't going to be different.
That's right.
If they didn't do the secondary for the employees pay for insurance, if they were going to raise from this other deal, then she needs to talk.
Ron. All right.
To be fair to him, since that is.
That's true. That's true. Okay, let's set that aside. Everybody okay with capping it? I mean, with bringing everybody up to the $50,000 level? The health insurance, we had talked about making changes there, deductible changes, co-insurance changes. Things we did not discuss was raising employee contributions, raising family costs, et cetera. I mean, we got a variety of things in there we can discuss. You want to give Carl
We don't
some?
need to do that until closer to the first of the year, do we?
No, not really. But part of this will impact the budget year here.
Well, that will have an effect on the budget.
Yeah, it would be effective until January 1st, whatever we did on that anyway.
Okay.
That part's not necessarily affecting my budget. That's if the employees put more money in, it's going into the insurance fund. That's where all the money.
Okay.
So it's not affecting.
Okay, so these are really issues to discuss as we get closer to the, but we also, they've told us they would really like, so that they can start shopping this hard, they really want to kind of know some of these answers now so that they can, we can't wait till January 1 when the new year begins. They need some of these questions answered now. So this is something, we're not here to make vote on this today, but be thinking about this so that we can give CAP some direction when we tell them, okay, go out and shop for our best deal for 2014 based on these changes or lack of changes. Yes. Yeah, and we're fast approaching that, 5 weeks away. Okay.
The big point that affects me as far as doing my number approaching is
Raises.
raises. What kind of raises? Who's going to get raises? Are you going to change the salary and all of the allowance
Not in favor of changing any of that.
Well, if you need some additional time to think about that, Carl's just saying, please give him your input. You've given him yours now, that's fine. You can ponder this and let Carl know what you're thinking.
I need to know because I've got to put, if we're going to.
Yeah, quickly.
Allowances, I've got to put it in the budget, and I've got to work on the budget this week.
I had to have it in the county clerk's office at 5 o'clock, so, or new kid and.
Okay.
Punch it in, again, for raises, I've got to go through every person, calculate
Now and again.
Okay.
So anything you're going to payroll, I have to know. Now, this is the way it works. You could, you're not actually voting on it. You're voting what you want to put in the budget workshop. And I'm going to put it in there. If you actually.
Then you'll bring it back to us for approval.
We'll approve all that
Yeah,
in
if
the
they all
budget.
that work, then we don't do it, but that is possible. Because I had a situation where Bill Russell put a big auto allowance in the budget, and I had to put it in the budget. But then it was voted out, the budget was voted. That was for my time, which we're not going to do every person's payroll. So hopefully whatever you decide here is what you're going to approve in court, but you don't have to.
Let's go over those dates one more time. That, the final approval would be the last.
Last court date in September.
What do we need to accomplish the first meeting of September?
If you're going to give elected officials a raise, I have to publish that in the paper. First week of September. Other than that, I don't think there's anything, because I don't think anybody is anticipating going above 43 cents. There will be no tax increase because we're not collecting any more tax than we collected the year before. Right? We'll go on to 43, we're going to be collecting less.
Okay.
So there won't be anything for any tax hearings. You'll have to have a budget hearing. At the same time, you approve the tax rate, and you can do all that on the last court date. I don't think that's a good budget hearing. So the only thing I can think of that we have to do is if you're going to give elected officials a raise, any of them, then you have to publish that in the paper. But I'm going to need to have a proposed budget in the clerk's office on the 30th. So I have to know what you're proposing that you want done.
Well, I'd say we need to make our decisions by the end of this week.
Well, yeah, really. Guys, we got to real close.
Okay.
You might be waiting that.
By the end of Wednesday. Or Tuesday. Okay. Okay. Mr. Horton?
Sorry to get it late, but I've heard a lot of passion pleas from the JP, personal attack by Commissioner Hockaday and Riddle.
I didn't personally attack him, I just told him what people had told me, Mr. Harden. So I did the same thing you're doing now.
And others that had the same opinion that I did, you're,
Yeah.
Ms. Barber is pleased with the results that you guys are doing, and I have a bone to pick with Commissioner Hill. That's my opinion. Others may not have that opinion. You get out and drive your roads. Are they in good shape?
Pretty good shape. Have you driven on mine?
But what? No, yes.
Why don't you go driving and then tell me that?
Neither here nor there. I'm worried about what the money is going to benefit from the raises. We're looking at tax rate increase. I know it's not a tax increase, but a rate increase, which the public is being more, they're going to be subjected to. Why? What do I benefit? No one has mentioned that at all to me. If you look around and try to private sector, people are losing their jobs, they're getting cut to 29 hours a week. On and on and on, and you're gonna increase the taxes on those people. Fixed income, poor people, don't even have a job, those that have a job, and they go to part-time, please consider that when you're looking at the tax increase.
Well, I do think a couple of things need to be mentioned before. Number one is anybody over 65, their taxes are frozen. They're not going to pay more taxes no matter what. Hopefully that takes care of most of the people that are fixed income.
I'm not speaking for myself.
I'm not saying, but I'm just saying.
I am comfortable with what I have, but I am associated with a lot of folks that are hurt by it all the time. And you guys need to take that into consideration.
I can assure you that we do. I can assure you we factor all this into consideration.
I might mention this, I don't know what it's worth, but the new Obamacare, the new insurance laws, people my age, 65 and older, we're not going to have to hardly pay anything more. I mean, it's very good to us. I mean, he was talking about, when you get 65, not having insurance. I didn't apply for the county insurance because my Medicare is better than that. So I just, that's just for general knowledge. I don't know whether that has any bearing on CAPS, but CAPS didn't say that, but he told me that. I mean, he didn't tell me. They had that meeting, and he went into that, and he alluded to it in a bunch of the numbers. That's just for everybody's, I don't know about it. I'm not an insurance person, but I know my insurance is cheaper than it would be going through the county.
Well, again, the county doesn't really have insurance. The county has a fund that we pay medical insurance out of. So whether you applied for the insurance or whether I have that insurance and I have low claims, the cost to the county is about the same.
Right, I understand, but but we were talking about the retirees.
Right.
That's why I mentioned that. Not the regular guy. The retirees is why I mentioned that. The retirees at 65, if they lose their insurance in the county,
they'll be in pretty good shape, at least we think.
Yeah. If you're less than that, your health insurance is going to be really high, according to stuff I've read.
Hey, Judge, do y'all have a record meeting next Monday?
Monday night.
Okay. At that meeting, you're going to need to have on the agenda a motion to propose the tax rate. That's where it's just like.
Motion to, what was, propose.
And then you would have to set hearings if we were going on to 4334, since we're not, you're not going to have set hearing dates, but you will need a motion to propose the tax rate.
How much? What date?
Next Monday night.
I'll be sure I get that on there. All right. Anything else to cover, discuss? Please keep in mind what Carl is asking you to consider, and let him know within the next 24, 48 hours so Christy can get her scrambling done.
Yeah, somehow we'll have to know what the consensus is.
Well, maybe you and I can put together kind of a summary sheet. Here's the answers, here's the questions I need you to answer for me.
Yeah.
All right. Okay.
Now, what did you say about diagnosing and college?
Well, there's two rates we're thinking about. The first rate, the rate is we don't take into account employee raises in the tax rate itself. And the rate is going to be $26.94 plus $14.11.
It's 4102.
That's what the rate is going to be. The rate right now is $39.90. Now, if they decide to give raises and they want to come to raises with increased revenue, they'll have to give another opinion. They'll have to give that, or they have to give the raises out on that. Or the other, or not give raises back. That's.
And sometimes if it's travel policy to accountability, that political accountability wants to have that one.
I would, I mean, no matter which way they did that, I wouldn't change the tax rate for it because I think the difference is only about $50,000 or $60,000. Because you're gonna get something for the miles of driving, and even if you use $1,000.
I put 6,000.
6 instead of 15 on 10 people, so it might be $90,000. It takes $220,000 to rate. My recommendation, even if they will do that, that's fine, but I wouldn't change the tax rate.
I think taxpayers is a very good idea. A lot of counties do the right to put a cap on it, so you can't just like I drive. A realistic cap number that is really requires.
All right. If there's not anything else, I'll entertain a motion to adjourn. I've got a motion by Commissioner Fields to adjourn. Yes, that'll be a regular Commissioners Court meeting, 6 p.m. a week from tonight. Motion to adjourn by Commissioner Fields. Second by Commissioner Hinton. All in favor, say aye. All right. Thanks, everybody. Good meeting.